Welcome to the Where'd You Go to High School podcast. It's the most iconic conversation starter in St. Louis. We're your hosts. I'm Anna Feckner, and this is Elaine Brewer. Two best friends from the 314 turning this classic STL icebreaker into a podcast. So grab an emo slice, pull up a chair, and let's talk. Because around here, it always starts with, where'd you go to high school?
Today's guest is Dr. Rachel Sullivan, a board-certified family physician and partner at BioBalance Health right here in St. Louis. She specializes in hormone replacement therapy and helps women navigate perimenopause, menopause, and all the what is happening with my body moments that come with it. Her approach blends modern medicine with a more holistic and preventative lens. Today, she's going to help us break down and make sense of what's going on in your body and, more importantly, what you can do to feel like yourself again. So welcome to the podcast.
Welcome, Rachel.
Dr. Sullivan.
So much but first, we have to start with, where did you go to high school, Rachel?
Well, I went to MICDS.
Yeah.
I'm almost a lifer. I started in third grade, went all the way through high school.
That's what I meant to ask, because I couldn't remember. I thought I was confusing Villa and MICDS, and if they had like grade school as well. MICDS does too.
Yes. Junior kindergarten all the way.
Yep.
Yes.
Wow.
So I was right.
Yeah.
I don't know a lot of people from MICDS. So what was the vibe there? Was that all girls?
No, it was co-ed.
Okay.
It was a non-denominational private school.
Only the best one in St. Louis. Even. I mean, how you haven't heard about it that much.
Sorry, us Berkeley kids.
I think you guys were like a whole different like weight and size class.
We were like just feral animals.
My cousin
guys.
came to Parkway North. Yes. Kat and Olivia McCarter.
When did they?
Oh, they were much younger than us.
Oh, great. Okay.
Much younger than us.
Well, they're probably more feral than you know.
They were perfect. I have nothing bad to say.
Ooh,
yeah.
Nice save.
Trying to keep the holidays very copacetic. And so I went to MICS. I still have so many friends from there. So we're just such close friends. But yes, we have so much fun. We had so much fun together. We're all still really close. I kind of joke that we're all very trauma bonded because when we were growing up, I mean, it was like the years where we had computers, but we didn't really have social media. You didn't have all this stuff, and your parents weren't tracking you 24 hours a day, 7 days a week. You could kind of get away with a lot. I mean, they really should have been. The fact that we all, made it is great.
Yeah.
But we had a lot of fun. We were all, MICS is very, or at least then was very sports oriented. So everyone was really driven, very
what sports
athletic.
Did you play?
I was actually the weird one. I did horseback riding.
Oh,
Yeah.
I was a hunter jumper, and I also,
I realized you did it too, because my daughter and Rachel's daughter ride at the same place now.
Yeah,
so I
actually had a horse at Krause Farms growing up.
I knew that. Okay, so then I should have known.
Yeah. So I was a hunter jumper. I ran track in the spring, and I ran the high hurdles, which I'm only 5'2". So that was
amazing.
Fun. So I did that, and I played golf. I was like one of the founding members of MICDS's golf.
That's cool. So did the boys have golf before the girls? Or
no, there were no golf.
Really?
Yes.
Parkway North actually had a sport that MICDS didn't. We had a golf for a while.
We had a golf team?
Yeah.
Holy shit.
Yeah.
Wow.
It actually pretty decent.
It's just like the Happy
there.
Gilmore.
You probably had some beer bonging going on before they played, but they were decent.
Sometimes it loosens you up.
It does,
I guess.
Loosens up that swing.
Exactly. I don't know about high school though. I mean, I felt like, you didn't have like joint pain and you were like working on your swing.
Yeah, I just went to Topgolf and I felt like I had like tetanus shots in both of my arms the day after. And I'm like, oh my God, getting old. Oh my God. Freaking sucks.
Yeah.
It's one of those things. I mean, I golf now a lot, especially spring and summer. We golf at least once a week. I do it for fun.
It's in your front yard.
It's in our front yard. Yes. We're very blessed for that.
Yeah.
But I love it. You do have to literally get back and used to it.
Yeah. I need to take
it's a whole different set of muscles.
I feel like I really get into it.
I was good.
You would do
dry.
Yeah.
How's the boob situation?
I was just,
away?
yes, but they're, so either you just go like together
Yeah.
or you kind of go over.
Over them. See, I think I'd have to go.
You kind of just have to get used to and stick with one.
I never thought of that. I don't get in the way, I guess.
Well, I think we're working with
Probably
like a little
dry.
over
Yeah.
here.
Yeah.
Yeah, lots of
No
sports bras,
offense.
extra sports bras to bring it down.
Well, I got a boob job, and all I do is just
Oh, yeah,
let
I
his
forgot
face
about
down.
Yeah.
Yeah.
Yes, he did. Very nice. Too.
Yep. I like that. Oh my
All
God.
We are not going to waste much time, although we love MICDS. There is such a wealth of information that lies within Rachel and this topic, and I feel like it just doesn't really get mentioned that much. Or I guess now it's really starting to come around.
Yeah.
Yes.
Locally, I don't hear about it as much from anybody as I do from you and from your business, which
Yeah.
is amazing because honestly, BioBalance saved my life because I just thought I was going insane and my temper was crazy. I mean, it got to a point where I was just like, there is no possible way this is normal to be like, feel this way all the time and to snap at my kids the way I snap at my kids and my husband, like just literally riding on a razor thin bit of sanity all the time. And then I started talking to Rachel and she's like, hey, do you not know what I do? And then I'm like, how's like,
Let's get you in.
Yeah. Yep. And I will never forget our first breakdown of my blood work.
Yeah.
And we'll get into this. I'm jumping ahead a little bit, but the cortisol part was my favorite because that is where you store your stress. And I did not realize that. And you were like, imagine it as a house. We either push it down or we let it out. And I was like, oh my gosh, I probably just let mine like fly. And you were like, you broke your house. Like you have no cortisol home to store your stress. And I was like, oh, so she's like, yes, that is why you go from 0 to 500 in half a second. So anybody else who's feeling that way.
Well, I think I'm going through it. You're going through it.
I started going through it when I was 29, which
Holy
is
crap.
really
Well,
early. Average age is 38.
Okay.
But I'm seeing patients younger and younger. And people are like, why is that happening? And I think I'm like chronic stress. I also think like just the way we grew up, like in plastic, we were standing in front of the microwaves constantly. We were always using plastic and Tupperware. We weren't aware of preservatives. We weren't aware of anything. So I think the chronic stress and all of our chemical exposure growing up probably wasn't the greatest for us.
Okay.
Well, we're like,
I'm opening up my question.
Not as
because, I mean, I have kind of been researching some of this and it's fucking scary. I mean, some of the accounts from people, of women who are going through it, just the lack of recognition from some healthcare providers. And then something is off. And sometimes blood work or whatever, they can't quantify it. And so I think let's start here. Because I want to know, and you just said, but say again, just in case anybody missed, like at what time does this really, the transition start?
Yes.
and by transition, we're talking going from
To perimenopause.
perimenopause into
Yes.
perimenopause, which
Fertile
is,
state.
Yes. So perimenopause is basically, if you're looking at blood work and you're looking at labs and you're thinking about yourself, you think all of a sudden, and we're all having kids later too. So this is a whole other thing.
Not me, sorry.
Oh, yes. I know. Like, I was 16. I was like, that was smart.
I
We
know.
should have all
did that.
Yeah.
You did that the right way.
That was
the way our bodies intended.
Yes. But basically, as we're aging and we're getting older, most of us are still having periods every month when we're in our 30s, but we start noticing that certain shifts happen. Things that used to bring us joy don't anymore. The motivation we used to have to exercise for some reason goes away. You'd rather sleep. And then sometimes if you sleep, you're like, I know I slept for 8 hours, but I don't feel like I even slept for 8 seconds. Getting out of bed gets harder and harder. When I was going through all this, I told my husband, I'm like, well, Evan, he's hot. And he's
Very good looking man.
so nice, and he's so smart, and he's so handy. He's just the greatest. But I was like, literally, I'm like, I don't know what's wrong with me. I'm like, I know I love you, but I do not feel like in love with you anymore. I was like, and I was like, it's nothing you're doing wrong. I was like, but what is wrong with me?
Yeah.
I was like, this is so scary and stressful, because I was like, what? Like, I was like, it's nothing that he did. No amount of therapy will fix it, because it's not like there's something wrong.
Yeah.
But I felt like there's something like inside me that was broken. And I kept thinking, well, we still wanted to have kids. And so I was in this, I've been doing this for 11 years, but I'm like, oh my gosh, we still want to have kids. When you start hormone replacement therapy and testosterone replacement therapy, there's really not a lot of studies on this with having babies. We just want you to be finished, just so we don't want any risks.
Yeah.
And so I was like, gosh, we were trying to have our first. We finally did, after some infertility struggles. She's 7 now. And then we were talking about, we wanted to have more. We tried and tried. I was like, I was so tired.
Yeah.
I gained so much weight. My testosterone was so low. I felt so bad that I was like, can we just please stop?
Yeah.
Like, I was like, I would rather just get to this next chapter where I can start this journey that I see with all my patients.
Yeah.
And we even almost, we actually have a little over a 95% success rate with our patients.
Yeah.
And I'm like, the whole time I was like, oh my God, I just want to be like you. Like, I want to get this going.
I didn't know this. That must have been torture to be the one that is literally facilitating help for all of these people. And you're just sitting there and you're like, I know what to do to fix it. I have the tools to fix it. But oh my gosh, I can't imagine that.
And so, and my husband, he was like, I was like, but I just didn't want to, I don't know. I guess when you're like MICDS, you're very high achieving. You're always very competitive. Then I'm like with medical school and residency, everyone's just always so competitive. Like, I always just felt like, it's just one of those things.
You push yourself.
Very push myself. I'm like, I can't just have one kid. Like, I'm an only child. Both my parents are only children. I felt like I was going to break like some cycle. I was like, if I just won and had another kid. But I was like, you know what? Like, God's clearly trying to tell me something. Like, it's just, we're not going to do it. And Evan was like, sounds great. And he's like, I'm like, actually, one of our friends got pregnant, and she was in her early 40s. And we were going back and forth for the vasectomy. And I was like, you know what? She calls me, she's like, I'm pregnant. And I was like, I was on a ski lift on spring. And I was like, congratulations. I'm so excited for you. We will all help you raise this baby.
Yeah.
Click. Hello? I would like to schedule my husband's vasectomy. Like, literally, like, immediately.
Yeah.
But I was like, can we just be done? And he's fully supportive. And I started pellets. I started my testosterone replacement journey, because really perimenopause is having estrogen still in your system. Like, your body's still going through cycles. You're still having periods, maybe not monthly.
So how old were you when you?
I started at 38.
Okay.
Yes.
How long were you feeling?
For 9 years before.
For 9 years before.
Wow.
Right around when we were getting married too. And I was like, my weight, like, I blew up. Like, I felt like I couldn't catch a break no matter what I did, no matter how much I exercised, how well I ate.
Yeah.
Everything I did, I felt like, and how perfect everything seemed like from my lifestyle. Right. Even if I tried, it didn't do anything.
Yeah.
And then I was like, I was like the biggest I've ever been out, like, on my wedding day. I was like, what? And I was doing every single thing I was supposed to do, or I thought I was supposed to do. And it was so frustrating. And so my patient was like, I've tried and tried and tried. So am I exercising right now? No. Am I eating well? No. Because even when I do all that, it doesn't do anything. Yeah. So what's the point?
Well,
and I felt that way as well.
I have a question on that. So yes, many people hear about weight gain during this stage.
Yes.
Is there any instances of weight loss?
With
perimenopause.
Yeah.
It's changes for a lot of people.
Okay.
So some people feel like, who are really strong and very muscular, and they're really like healthy, high muscle people, when they start going through perimenopause, they can't get the gains that they used to. So their muscle mass actually goes down. I call people are like, I know, I go to my doctor and they say I'm skinny, or I'm a normal BMI, which is literally just your height and your weight. It means nothing. Yeah. And we've been debunking this constantly. And mainstream medicine starting to catch up with this slowly. But I get them. We do an in-body machine, which is this incredible machine.
Love it.
That literally sends a small electrical signal through your body. It's highly accurate, and it looks at your body fat percentage. And my people who are like, they go to their doctor and they're like, everyone says I'm a normal weight or I'm very thin. And my friends tell me there's nothing to worry about. I'm like, but I'm losing weight. I don't feel strong. They have a very high body fat percentage.
Skinny fat.
They're skinny fat.
Yeah.
Yes. They're 40% body fat.
Yeah.
So they're like squishy and they're small, like they're just not defined and they don't feel like what they used to be. But
Yeah.
yes, some people can have like weight loss or definition loss.
Mhm.
Okay.
Yes.
I also look at the divorce rate. And again, because, and I got this on a different
It's
podcast.
very true.
It made sense. Like, and I'm not one to be like, oh, women have been shit on forever, and like we're now it's our,
Yeah.
but,
Yes.
we're doing all right. We're
moving.
we're doing okay. But
Yes.
like, we are kind of ingrained to just from a very young age, because you can start your period at like 9, anywhere from 9 to 14.
Yeah.
That's young. So from a very young age, it's like you are going to be uncomfortable and you still have to do everything that you normally would do when you're not feeling this. And through the fatigue, the cramps, and blah, 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 and the hormone fluctuation during your period. And it's like, okay, we understand that like you're going through this, but like you got to get up and do your job. You got to go to school. You got to do this. And so we know from a really, really young age, we're going to be uncomfortable for a lot of shit. And
Yeah.
we
You just
are.
have to kind of put up
And,
with it.
but if you were to reverse it, if men were to have felt like uncomfortable,
Oh, yeah.
like we would have this would have been talked about and figured out
Immediately.
decades ago.
Yes.
And it's like,
Especially if they're at such a young age.
yes. And I'm not trying to like shit on men or anything. It's just,
Yeah.
it's very true. And God, I feel bad for the generations before us where it was like, smile and suck it up. Like it's part of getting older. And that's what a lot of doctors still
They're
tell
still
women.
telling people this all the time. And it's one of those things you're like, well, I'm not sleeping and I have anxiety and I don't have joy in my life like I used to. And they're like, well, here's an antidepressant and here's an anxiety pill and here's a sleeping pill. And oh, that doesn't work. Let's crank up the dose.
Well, even what you
like,
were saying about like my husband didn't do anything, but like I feel like dead inside about it. And it's like, how many divorces happen because of that when it's like completely out of the wife's control?
Yeah.
And
most times the men are losing testosterone about a decade or so after.
Right.
So you have this 10-year gap where it's all in control. And then when the men start losing that, like, they're like, what's wrong with me? I got to do something. And then, they're like 10,000 T shop, like low T centers.
So they didn't know what was going on.
Yeah.
They were like, here, buddy, just take a shot.
Yeah, exactly.
So when I went in, because I was having a lot of symptoms and they refused to do hormone panels on me.
Yeah.
They told me women don't start menopause until 50, which is like, well, menopause is a year, right?
Yes.
Without getting
periods.
Yeah. And so just totally not even recognizing that there's about a 10-year period, if not more, before this. And
that time with perimenopause, you still have estrogen and you're still cycling, but you have no testosterone. And free testosterone, actually, I have this book. Where's my book?
Oh my gosh, you brought it.
Did I bring it?
I don't know.
Where is it?
I saw
Where
it.
did I see it?
Is it your mom's?
Yes.
Yes. I was going to remind you to bring
Okay, I literally brought it. You guys, this has been in my car. It's like, looks like I go to door, but I literally show it to people. So this is my mom's book. My mom's my partner. And she's an OBGYN. She's truly the greatest. She's awesome. She wrote this book called The Secret Female Hormone. It literally, testosterone is the secret female hormone.
Yeah.
When we are, when we're in biology and we're learning all this, estrogen women, testosterone men.
Yes.
It's not.
Yeah.
Women are so much more complex than that.
So many women think if I put testosterone in me, I'm going to like bulk up.
Or like transition.
Or like grow a beard. Or like,
it has nothing to do with it. Yes. But and it's so sad that you get overlooked.
Yeah. Well, and those are some of the things I wanted to get into. Well, okay, let's start here. What are bioidentical hormones? And is that a new thing, like previous to bioidentical hormones? Were we just giving out non-bioidentical hormones? And what is that?
Yes. So, okay. So bioidentical hormones are literally a chemical compound that are bioidentical. They are 100% identical to hormones in the standpoint that your body used to make or currently makes. So they are identical. If you said, both, samples, or if you go down to the chemical compound of both testosterone in your blood from when you're younger and testosterone from what you would get in the pellets that we use, which we'll talk about, they are identical. You wouldn't be able to tell the difference.
What are we comparing here? Our bodies before perimenopause to when? Okay. I just want to know when
we're younger. Yes.
When we're younger.
And I also read that one of kind of the difficulties in hormone panels is it is just like a screenshot of that day. And so it's not showing the hierarchy, like, if you get your period or whatever, you're in a certain part, one may be up, one may be down. So it's not giving a full picture of what's going on.
Right. So for some of those, for some hormone tests, that's absolutely true. You are 100% correct. And for certain times in your life, that can be correct as well.
Okay.
So what I always talk about with every single patient who comes in, so before you would come to us as a patient, you would get your blood work drawn, you'd fill out a questionnaire, and we would review that.
Okay.
So to really make sure, yes, we run tons of tests on you. And we really make sure that you're a candidate because you got a lot of people trying to get a lot of stuff that don't really need you or they need something else.
Yeah.
And so we really try to make sure that you're a good candidate. But when we check your labs, I print out all your blood work and we literally go through every single test together. And the first thing we talk about is the reference range on the right side of the page when you get your labs drawn. When you get your labs drawn, there's this range on the right side of the page, which literally is what everyone believes is what is it normal or good. That's oh, this is what your range should be. So if you're high or low out of that range, that means something's wrong. But the problem is that is an average range. That is an average range of women. Here, if you're getting your labs drawn here in St. Louis, the labs you're getting, the range on the right side of the page is a range of women 40 and up, and they're all Midwesterners. So you're being compared against 40 to 140-year-old perimenopausal and menopausal Midwestern women. Yeah, that's what their blood work looks like. By then, the disease door is wide open.
Right.
So a lot of times you're being told you're fine when you're not, and you're not fine when you are.
Yeah.
So all the people, they're like, I don't even know why you're seeing me. My testosterone's fine because it's in the range. That range is based on women who have no testosterone in their body.
Yeah. So, the stats
no one
that
has
basing it on are baloney.
Exactly. So a free testosterone-free healthy woman of any age with a great sex drive, great energy, no disease, no cancer, great muscle mass, no autoimmune disorders, and great mood and great sleep and all these things. That range is 15 to 45.
Yeah.
And the current range is basically 0.2 to 1.8.
Yeah.
So you're going to the doctor, and if you're free testosterone, mine was 0.8. But I went with the doctor. Yeah, I think. Yes. And if I went to any other doctor, they'd say, oh, look, you're in the range. So it's not that.
Yeah. Because I found this interesting. We all know that the anatomy that is studied in medical school is one of a male, right? And how much time is actually spent in medical school on this
Hormones
transition in hormones and yeah.
Do you study the female body?
So I went to an unopposed family medicine residency, which basically means I worked in a hospital in Houston. Shout out to Memorial Hermann. But I went to a residency in Houston where there were no other residents of any other specialty in the entire hospital.
Okay.
So I was my small residency group and we were the ones delivering the babies. We were the ones running the codes. We were working in the ICU. We were going in for heart caths. if there was something
She's a
going
very well-rounded
we
doctor.
were doing the pediatrics, we were doing all, so if there was something going on in that hospital or in that system, we were the ones doing it. So there wasn't a pediatric resident taking my spot. There wasn't an OBGYN resident taking my spot. There wasn't, there wasn't internal medicine working the ICU.
You
So
literally were every
literally every half. So we, at the plate where we went, and we're also trauma bonded. So, but we're all still very close, but we learned so much, and we had a big, really wonderful, robust education in a lot of things.
Yeah.
We weren't really trained on perimenopause, but we were actually trained on menopause. But I think we had like a week of training.
Yeah.
But if you talk to OBGYNs, there was it was a big national conference, and they were asking OBGYNs how many days or how much time they spent in residency learning about perimenopause and menopause. And it ranged from 0 minutes to 2 days.
Yeah.
Yeah.
So my mom was an OBGYN when she was going through all of this, and she talks about this in here. She was going through all this. She had no clue. And if there's any like our parents, she's very she's a famous OBGYN. She's truly incredible. Like I'm obsessed with her. But
Google her mom.
Yes,
Kathy
Moffat. She's incredible. But lots of people remember her. She sometimes would deliver babies in cocktail gowns because
that is so spot on.
Which is like, I was like,
hard.
of your parties? She's like, sometimes. Yeah. But she's incredible. She's so smart. And she was treating women with hormones, but she was, using patches, or she was using Premarin pills or gels and creams. And when she had a hysterectomy, really none of that stuff worked. And because none of that is either bioidentical or it's not absorbing in the right pathway for your body to recognize it as truly bioidentical. So she was having a lot of struggles, and this, really goes through it. I saw it. It was
so did
wild.
She call bullshit on the black box warning?
Oh yes, many years ago. Yes,
she's one of the pioneers, man.
She really is. So she's been doing this for 25 years.
We need to do this again and have both of you.
Oh my gosh! Then I just sit there and listen. She's so great. But she actually, I always call it the enterprise method, because when she started this practice, when I was in about 8th grade, she basically said, like, this is either going to take off and it's going to be incredible, or
good for her,
or like when my parents were growing up, they were very poor. They had no choice of where to go to college. That she was like, you won't have a choice. You're going to just have to go somewhere you get a scholarship. Like we might have to move, all this stuff. So if it fails, it's going to be a big, it could be catastrophic for my life. And for our lives. And so I said, you know what? I was like, I saw what it did for her. And I was like, great, let's do it.
Yeah.
Let's do it. So I started,
inspiration though, to just watch her try.
Oh, amazing.
Like it could fail, but it's like, she knew it was her job and her duty.
And when after she got Pell's first time, I was like, oh, okay, you're back to normal. She was really wild. And she was very unhappy too. And she'll tell you that. But I was called the enterprise method because when she started, this was all new. And I started working there by cleaning the floors, cleaning the offices on the weekends. Then when I got older, I was doing, blood pressures. I was getting people on the scale, doing all these things, helping with paperwork, helping with filing. Then I was in college. I was business. I had a BBA so that I could really learn the business side of things.
I didn't realize
my mom did not know any of that because that's not, she didn't know she was going to be on her own.
Yeah.
Most of the time you think you're working just for a hospital system and somebody else will take care of it.
Right.
So I helped with marketing back then. I helped with, the accounting. I helped, really try to fine tune and really make it a successful business where it's not just, you're breaking even at the end of every year. So I kind of worked it from that side. And then I went to residency, and actually I'd asked my mom what medical school I should go to. She said, be a DO. She's like, because I'm an MD. She said, and I had to learn how to talk to people after medical school. I had to learn how to, I had to learn how to go through all this medical information and not use big words after. It took me years to figure that out.
Like the bedside.
Yes.
Just gonna say, you
can't
teach that.
And she'd be like, and I don't know anything. I didn't know anything about nutrition. I don't know anything about exercise. I don't know anything about preventing disease. I just know about treating disease.
Yeah.
And she was like, all the DO residents that she had at Mercy, she's like, they know all this stuff. And she's like, you need to go to a DO school. So I went to AT Still University.
DO means?
Doctor of Osteopathic Medicine.
There you go.
So it's you can be all the things that an MD is,
Yeah.
but you actually have a significant amount of training and the human body.
Take a whole, like,
a lot more
holistic
approach.
Okay.
Yes.
Yeah, I didn't realize that.
Yeah, because I switched. I got my second opinion. I went from an MD to a DO.
I don't even know that I realized that was a
Yes. Yeah.
thing. What year did she write this?
2000 and
So how long had she been,
a long time.
like,
Literally.
around 30 years when she wrote the book?
She'd been doing it for around 10, 15 years.
When the book was written?
Yes.
Okay, so let's talk like red flags, warning signs, like what things would be coming up around this transition that you're like, it's time to get your hormones. It's time to come and see me and figure out
Yeah.
what's
I
going
mean, I think it's all the things that you already know are going on, but then you talk to somebody or your doctor or a friend about, or your parents, and your mom's like, yeah, I mean, you're in your 30s and you have young kids, like, and you have a job. Of course you're tired. Of course you don't want to have sex.
It's stuff you can write on, but you're like, it shouldn't feel this bad.
Yes. Of course,
Yeah.
like you get home from work and you just want to sit down and not talk to people. Like that's not, if that's not who you've always been,
Right.
that's not something that you need to accept. So
I think it's more difficult for me because I've kind of been in like a chronic fight or flight, like recently stopped drinking alcohol. And then, so it's kind of like, is it this? Is it this? Is it like, what is it? But then it's like, I'm going to the doctor and saying, I'm having all this unintentional weight loss. I'm having brain fog. I'm depressed.
brain fog is a big one.
Sleep disruption, hair loss,
Night sweats.
Oh yeah. Night sweats are interesting because you're not in menopause.
No.
So people are like, well, you're starting periods, so it's not that, but night sweats are directly associated with perimenopause as well.
Skipped a period. And then now I've had 2
in
this month.
Yeah.
Yep.
And like, again, when we went back to our post to tease this, like if my husband breathes or chews around me during the wrong week, it's murder central. We just kind of get called crazy or, you know, and especially if you have a lot of things, just life stress.
You have a lot going on.
You can easily write it off. Some of this off. And so
they'll say that all like they're just like, you've got so much going on. Of course you feel that way.
If I can jump in for a second, because this was the part, like we were talking about when you read through the blood work and you were going through it. And I can say from experience, someone who has done a lot of therapy, I learned more questions about what I was going through and what I felt and was feeling was answered in that 20 minutes of
an hour.
In that hour of reading my blood work than all the therapy I had done. And it was literally, she would be like, because I'd be like, I don't know why I'm snapping the way that I snap. I don't know why I go from 0 to 100 the way that I do. I'll be happy 1 second and then my child will drop an ice cube and I'm like, what are you doing? And like, that isn't who I am.
Right.
And she answered all of these questions based on hormone. Like you can go and talk until you're blue in the face to a therapist about it and they can teach you ways to, control anger and calm down. And that's helpful. And you need those tools too.
Especially in times when I would say, if you're like, do they deserve it? Like, do they deserve Like, is it something that maybe you should actually be yelling about? Sure. But maybe you shouldn't go that far.
Yeah.
That's where therapy works. When you're like, yes, like there's like my kid is acting out, but I don't need to be the one acting out along with them.
Right.
That's not helping the situation.
Right. No. And then you're setting a bad example. Yes. I'm like, don't yell.
Yes.
And then I'm like, but I'm
yelling. And that's like, this is like, so, and there is like, therapy has a lot of great parts to this, right?
But this had all the answers.
A whole different thing.
And again, I'm going to say it again, and I don't care if I've said it 20 times before. I had more questions about what I was questioning about myself answered in that office visit than years of therapy and medication, antidepressants, anti-anxieties. That was the most beneficial sit down doctor meeting I've ever had. And I highly recommend it to
Everybody setting an appointment ASAP.
Love it.
Before she leaves, you're going to get on the books.
I love it. Yes. I mean, it's amazing.
Yeah.
I actually, so when I finished residency, I really love primary care. Like, I just love it. And I didn't know if I could really integrate that into this practice fully because, well, my mom's my partner. She's an OBGYN. Well, what is funny is every week when I was in medical school and residency, we would talk on the phone. She'd be like, tell me exactly what you're learning. And we'd go through stuff. She's like, I didn't know that. What I didn't know is that I was essentially putting her through my family medicine residency training.
That's awesome.
And my DO training. So she was learning so much. And she was like, okay, now I can take care of men. We see men as well. I've been seeing men since for 11 years at our office. She is as well. So we've been really integrating this. And so I started doing primary care along with this. And we have a smaller practice in Kansas City, Missouri as well. So I go there every month. I'm going there next week. And I have a nurse practitioner, full staff there as well. So we see patients there. And it's so funny because we literally, we're talking about this. I'm trying to do primary care. I'm trying to do hormones. I'm seeing all these hormone patients and my patients are like, I want to be better.
Yeah.
Please help me. Tell me what I need to do. I'm going to do it.
Yeah.
Vitamin, sure. Supplement, great. Anything I recommend isn't just cookie. It's not cookie cutter. It's not like every single person gets the exact same thing, which is why it's hard, to sell and franchise. Like if you see a whole bunch of pop-ups at the same place or the same, kind of practice, they're all giving every single person the exact same thing, which sure, I'm sure makes somebody a ton of money, which, whatever. But I always say, but do you sleep well at night? Right.
Yeah.
So
are you actually helping this person's problem? Just making them.
And my hormone patients, my pellet patients are like, tell me what I need to do.
Yeah.
I'm going to do it. I might stumble, but I'm going to try. I'm listening I'm thinking about what you said. I'm looking through your notes. I really want to try. And then I go to my primary care office and I'm like, hey, did you know that you wouldn't be on insulin for your type 2 diabetes if you just didn't drink a gallon of milk a day and drink 3 sweet teas?
Yeah.
I was like, if you just took away half of that, I could probably get you off insulin. They're like,
but I love my milk
and I love my tea. I'll just take the insulin. And I'm like, I felt like I was just I felt like a drug dealer. I just felt like I was constantly just signing scripts.
Yeah.
So now when I see my patients at the office, I do integrate that. So if you're seeing me for obviously hormone replacement therapy, that's usually, and I tell people if you're really over a certain age, there's not going to be 100% success if you don't have your hormones replaced. So that's always that's the central part of it. But I mean, literally yesterday, I got a patient off of 3 medications.
Yeah.
3.
Yeah.
Is it true that there's almost like this shortage in hormones from pharmacies? I've heard
the estradiol patch. Yes, right now there is a shortage. Okay. So let's talk about types of hormone replacement therapy. So we have creams and gels, right? Okay. Like topicals. You have something called troches, which are like little lozenges that you kind of dissolve in your mouth and then swallow. You can have vaginal tabs. You can have shots, injections. You can swallow pills. And then you can do what we do, which are pellets. So we'll start with pellets and then we'll talk about why we chose those over the rest. And cut me off if I'm talking too much.
No,
I just love this.
I do have a question though.
Yeah.
Are the topicals and the patches the most go-to, most known for people who don't know much about this?
Patches and pills are probably
okay.
And I don't know. It's the things I'm seeing these days are wild.
Well, I'm hearing more about I'm hearing more commercials, and I'm like, that doesn't sound like.
Well, yes. So the pellets, I use the pellets because.
Can I just ask one
sure.
thing? When you go over these, I've heard that estrogen works very quickly. Testosterone takes a certain
3 to 4 weeks.
Yeah. So can you kind of tell
the audience?
Yeah, tell the audience that, and if that differs with topicals, pills,
we break the fourth wall here.
Yes. So yes, why not? Let's do it. So let's talk about pellets because that's what I do. Okay. And that is truly the top recommendation. Well, for me, not because I always say, I could write everyone for creams and gels and patches and pills, and I could do that easily. That's a non-issue, but I choose to do the pellets and I choose to try to do this because it is it's superior. It really is the best. So I use bioidentical pellets. I use testosterone pellets, and I use estradiol pellets if you need it. That's usually for
And you just
if
pop
you're
it.
no
Oh, what is
pellets are literally they look like little grains of rice. They're really small.
I think just like rabbit food.
Yeah. I mean, yeah, totally.
They do.
And if you've been in if you like know anything about farming or like cows or horses, sometimes they do use pellets in hormones for those animals, which is crazy. So, but literally we have very specific types that we get from two different pharmacies that we've been using for over 20 years. We start with yams, or the compounding pharmacies start with yams or sweet potatoes. They find the bioidentical chemical compounds that are identical.
So you mean an actual yam? I thought that was an acronym.
No, like sweet potatoes.
Sweet potatoes. Okay.
Yeah.
All right.
And they basically extract those hormones from the yams, and then they do their fancy science stuff, and then they compress them into little pellets that don't have any they have no preservatives, no fillers, no capsules, none of those things. Then when you see me, we go through your numbers, we go through your symptoms, we go through your activity level, do you have a lot of diseases, are you on a lot of medications, let's look at the whole picture. And then we come up with I come up with a very, very well-educated guess on where we start with your dosing. I then have your pellets there, and I give your dose. I write, type in your dose, all that kind of stuff. Then I have a nurse practitioner or my physician's assistant takes you to their office, and they talk you through the procedure. And the procedure is you lay down on one side, and we clean you up with some, surgical cleanser. We numb you up with lidocaine, just like what you would get at the dentist. And you feel a stick and a burn. You really shouldn't feel anything else.
Not bad.
Then we make a teeny tiny little incision, really like at the top of your butt cheek, kind of by your hip. For a woman, sometimes men, depending on how many they need. Sometimes we do it in their hip and or their love handle. If you got a guy with the love handle, you can do it there. And we make a teeny tiny little incision, something that is not a big scar. It's not, you don't have any worry about your scars. And basically what I use is like literally a medical straw called a trocar. And we insert that in. You don't feel anything. Put the pellets in, put them in through your fat, pull that out, put on a little steri strip. Just a tiny little
like a little sticker.
Just a little sticker, close up the sides, no stitches or sutures. Then we put a little dressing over that you take off in the next, either that night or the next couple days. And then you live your life.
And it's like time release.
And it's slow, basically
every 3 months, right?
Yeah, every 3 to 4 months, usually on average. And that dissolves in your system basically if your body needs more of it, it's going to pull more of it and use it more quickly. If your body is, your body basically just pulls it directly into your bloodstream, just like how your ovaries used to use or we're using it and making it. So when your body needs it, it pulls it out. When your body uses it, use it. And those dissolve entirely. So it's not like you have to ever do anything where you're pulling these
even have to
out. You don't have to think about it. So it's not part of your, you don't have to worry about a daily routine. You don't have to worry about anything. You come in 3 times a year, you get it, you leave.
My husband just started his, so
my husband got them now too.
And you can feel it. Like this is not just for women. His are more on like his back, and I only have 3 pellets, I think, but because men need more. I forgot how many.
A man's free testosterone should be free testosterone, not total. Total just means it's there, but it doesn't mean it's working. So free means it's actually actively working in your bloodstream and actually helping your body and helping your cells. So a man's free testosterone should be over 129. And ours should be 15. Well, so we don't need as many.
We were at 0.8.
Yeah, we were at 0.8.
I work with military communities so much, and especially in my husband's former job, there was so much, low T, cortisol imbalance.
Oh, yes.
And there was so much infertility within the special operations community, and it was mostly coming from the guys. Like,
wasn't it? Because of
it took us 6 years to have our second, and it wasn't until he left the command and started riding the desk. It wasn't having the operational
high stress state.
And
talk about fight or flight.
Happened, but they had told us, nope. You're not going to have another kid.
I was a good friend of mine's husband. He is young, but he was in the army and he was traveling around. Basically, he was going to a lot of places that had had Agent Orange exposure many years prior. Clearly, he wasn't there when we were in Vietnam, but he was there, and he had all this exposure. And one day he woke up, he's a type 1 diabetic.
Oh,
He
my
get
God.
married, yes.
Yeah.
And they're like Agent Orange. And then he's like, well, and then they're trying to have kids. They can't. He's told
That's still in the air.
Well,
it's still
everything, but
Wow.
from the burn pits.
Mhm.
Wow.
And you also, we send people around the world to clean it up.
Yeah.
As well.
There's a
Yeah.
lot
And they're
of
getting all this
physical
exposure.
Wow.
that's going on that
Mhm.
legislation just passed because that wasn't a part of
No.
disability ratings.
Which is
And
insane to
Yes.
think about.
And so, and he didn't even, I mean, he's like, he had no idea. Also, you're young, you're in the
Yeah.
military,
Yeah.
you're young.
no,
you know,
no.
Yeah.
whatever, whatever stupid stuff up that, I mean, and so they ended up actually having 3 kids, but it was also after was stopped,
Yeah.
traveling and didn't have that direct constant exposure
Yeah.
that they were, they bought an apartment. They were going to be like kidless.
Yeah.
And then
And
real life
And then
happened.
3 kids and,
We had just bought
Yeah.
epic passes,
Yeah.
a ski resort, a camper,
Yep.
all types
See?
because we had just moved to Colorado. And we're like, yeah, we're going to
I will never forget when you
find all
called
the
me
14ers and everything. And then it was like,
and told me you
there
were
we go.
pregnant, and I was like, "Shut the fuck up! No, you're not. You and
But
you
it's so
can't have
true.
any
so
more
8
kids."
years apart.
Oh my God. That's amazing
Yeah.
though. It's
Yeah.
just so great. I love that.
Yeah, right.
And truly, and I always say yes. And they still don't know how we got pregnant with Kate. I was like, I don't know.
Because she's a miracle
Yeah.
too.
Yeah.
She's a miracle as well. But it's
Miracle baby.
Woo! I love it. Yes. It's the best. And I love
Yeah.
that. But it's one of those things where in the military, I have tons of patients who are
Yeah.
military. Tons.
Maybe I'll sign my husband.
Yeah.
Honestly,
I
yeah.
tell people, I mean, I literally had a guy yesterday, he's in his 60s, but he's lived an insanely stress-free, very, very clean life. And his wife,
Yes.
and
Must be nice.
his
Yeah.
wife needs pellets. She's in menopause. She's got a lot of symptoms. She's significantly better. And she brought him in. And his free T is 119, but he's in his 60s. I mean, that's pretty good.
I was just gonna say.
So I was like, and he really doesn't have that many symptoms. So, I mean, I tell people, if you don't need me and I don't need to replace your testosterone with pellets, I'm not going to give them to you. So for him, I'm like, honestly, I'm sure all your friends are on it. And if he had a big case where he's like, hey, I know my numbers are pretty normal, but I feel awful.
Mhm.
It could be that he just had extraordinarily high testosterone levels when he was
Yeah.
younger, and I just don't have that record. So you can always plead your case. But for this guy, I was like, he's like, and I was like, well, why don't we work on your cortisol?
Right.
Why don't we work on your thyroid? Why don't we work on all of these other things around your testosterone? And then we follow up. And if you're still low or your symptoms are getting worse just because, now you're 67, now you're
Yeah.
68,
Yeah.
maybe we need to treat you. But right now, unless you beg me for them and you give me a really good case for it, I don't.
Well, that's
need it.
also what I was gonna say. If anybody was on the fence about the pellet, route, you've told me of specific cases where people just really treat what they have going on with supplements, and they offer the supplements there, and
Yes.
you can go the supplement
Yes.
route. And
I tell people, I'm like, believe me, I don't want to sell supplements. I really don't make money off of it. But my goal
But you
is
need
for
it.
you to be able to have what you need when you leave. Because before we did all this, Dr. Hoffman was doing a little bit of this before, but before people would leave and they'd be like, oh wait, what was I supposed to do? Or I can't find this.
yeah,
And I would I'm like, I'm looking for it. Now there's a shortage of something, on
Yeah.
a certain website or whatever. So what I would do is I just said, you know what? It's not out there, so I'm just going to make it myself.
Mhm.
It's here and I love this product and don't want it to go away. So I'm going to buy it and I'm going to have it for you so that you can leave with at least one bottle
right.
of
Yeah.
what you need. And you're not leaving with the same thing that the person, behind you in line is, or the next person I see is going to be on. It's really all custom to you and what your blood work looks
It's
like.
completely tailored to your
Yes,
blood work.
That's
totally.
amazing.
Yeah.
And
I can't wait.
yes. And so
It's
the
exciting.
first appointment I see, if you're for the hormone replacement part, you always see a physician. I tell everyone, there are a lot of places where you don't, and you kind of get what you pay for.
Yeah.
I want you to be able to sit with a doctor, have some most doctors, they're in and out and they're clicking the refill button.
Yeah.
I want to be able to sit there, talk to you. I've read your questionnaire that you filled out before. I've gone through all of your blood work before. I've gone through every single thing that you've submitted to me before. And I really make sure that I know as much as I can about you from your paperwork. And then we talk, and then we go more in depth into certain things, and we have big discussions. We go through all of your blood work line by line. And I want to make sure that you know what you're doing. I want to make sure we know that we have a good solid plan. And then if you want, obviously it's always your choice, but 99% of my patients are like, you know what? Probably more than that, probably closer to. They're like, fix me. I'm literally here. And most people don't come to me as their first stop, right?
Yeah.
Like if, B12 supplement fixed it, they're not seeing me, right? Like they've already tried this stuff. A lot of them have, or they've already researched it or they've already been told by their doctor that's not their problem.
Yeah.
So my patients are like, let's do it. Let's go.
Yeah.
You would get your pellets and you get your testosterone and or estriol replacement the exact same day. And then after that, we see you basically. For a woman, I'd see you back in about 3 months. For a man, I'd see you back in about 5 months. Why this difference? Because men can handle a lot more testosterone than women can. That's what makes us different. And that's that's why our levels are so different. So after that, you get blood work again before that appointment. And not only am I following up on all of your hormones, but then we talk diet and exercise and some supplementation in the beginning. The next round, I really go deep down into your vitamin levels, because I want to see what we do first.
Yeah.
If that's really what all you need. Maybe we just need to fine-tune your diet.
Yeah.
Maybe we just need to work on a couple things, and then your nutrition is great. And if it's not, and your vitamin levels are still low, we add on. Then I sit with you for another hour and we go through all of your symptoms, and I say, hey, how is your sex drive? Is it perfect? Is it exactly?
It's literally like a therapy session where you get all medical answers too. It is incredible. I cannot recommend it enough. What was that other thing that because this
was about cortisol. We talked all those things too. Like it's so much.
Well, the cheek swab test.
Oh my God.
That I didn't know that this existed either.
Yes.
And as someone who has tried every antidepressant under the sun, and you do a little swab in your mouth and then you send it away.
And I give you that for free. Like that's just you and your insurance company.
Yeah, no, that it is. But I didn't know about this.
I want you to
until she came, or she told me, and then it like puts your swab into a system of every medicine that's ever been created on the planet. And then it takes your genetics, and then it shows you, okay, if you have depression, these are the depression medicines you should be taking. These two, they might help you, but like
dose differently.
This is doing absolutely dog shit, nothing for you. And I was on so many things that I shouldn't have even been on, and I didn't know that was an option. So
that's called that's called a gene site test. Exactly.
Yes.
And I tell people, I'm like, so I can't guarantee, I never guarantee that if you're on an antidepressant, or you're on ADHD meds, I never guarantee that you will be off of those entirely. Or if you're, but I do say that frequently, either you will need to require a lot lower dose, or you might not need to be on as big of a dose as you are, or maybe you need to be on one thing instead of three things.
Yeah.
But I can't guarantee it's always going to go away 100%, because how long has this been occurring to you? Did this just happen in the past few years, or has this been lifelong? And I tell every person who's on medication, like a psychiatric medication, do not stop anything you're doing.
Yeah.
Don't change anything. I don't want you to leave here and be like, I'm not taking any of my meds. No. I want to be able to, that when I see you at your follow-up, that are your hormones truly balanced? Are you on enough? Have I fully worked up your thyroid? How's your cortisol? What's everything looking like? How do you feel?
I just love that you guys base everything off the person, not stats.
Yeah.
Yes.
We're basing how you grow off of you.
Like, I don't like taking daily medication. I'm not on anything.
Yeah.
Like, I'm like white knuckling. What am
Polar opposite.
I'm raw dogging life right now. And,
I don't know how you.
And it's just like, but I would rather do my nutrition.
Yes.
I'm hearing things about how like alcohol has estrogen in it. And so I'm wondering.
Alcohol converts to estrogen.
Yeah. Okay. And so I'm wondering if like maybe when I stop drinking, that really significantly caused a shift or
And it
anything
can.
like that? Or can I just fucking eat a bunch of yams all day?
There was, oh my gosh, there was a really cute show, a Netflix show, like Ginny, what was her, it was like two old ladies. They were talking about yams and yam cream too.
I can't.
Yes. And so we'll talk about that too. But
Yeah.
the gene side test, so Anna, and she was basically like, listen, I'm on medicine,
I take a lot of
but it's
pills.
not, I don't think it's doing what it's supposed to be doing. And if it is, like, and I say, listen, maybe Anna's just a person, she's going to be on it. Or maybe she's just, you're moving, like you got a lot,
right now
you got a lot going on.
Yeah.
But, so say you got a lot going on, maybe that's what it is. But Anna's like, something, I don't know if the medicine is doing what it's supposed to be doing for me. And I just said, well, what have you been on? Oh, well, I tried this. It didn't work. I tried this. Oh my gosh, I felt horrible. I tried this. And I was like, what are we doing? Like, you're going to your doctor. This worked. Okay, let's try this for another month. Oh, I didn't change how I felt.
Yeah.
Oh, let's give you more Prozac.
Yeah.
Oh,
It eliminates having to do trial and error.
Yeah.
Oh,
yeah.
laundry list of medicines.
I was like, you've been doing this for a long time. And some people, I just stop right away. Like for my daughter, for myself, we're not on anything. But I thought one day if something happens and we do need to do something, I need to know what to start right now. So I just have it, documented.
Yeah.
But so basically I was like, why don't we do this gene site test? We swab it. It literally comes back within a week.
Yeah.
And it literally is like green, good. Yellow, maybe good. But like for mine, it was like
Red.
like red means or it will negatively affect you. It will make you worse. And it does it for antidepressants. It does it for anti-anxiety, sleeping medications. It does it for ADHD medications, mood stabilizers, everything. Even if you don't want any of that.
Last months and up and down mood
you
cycles
don't have to guess.
Trial and error medicines that aren't and you may not even end up trying the right one because there's so many out there.
Well, I did mine and literally there's no medication, like no mainstream. Prozac's actually terrible for me. Paxil's terrible for me. Lexapro. I mean, literally every single Zoloft, every single one that would be your standard starting
go-to.
Truly is an awful medication for me. And luckily I've been blessed. Actually, I would say like in high school, when you're like, your parents think you're crazy. Yeah. Also, when my mom had her hysterectomy, she was crazy. And then she was like, you're crazy.
Yeah.
So that was like 8th grade, 9th grade. We're working on all this stuff. Right. And I think they put me on Lexapro and I was truly worse. Like
it gave
more
insane.
And I was like crying like over.
It was so bad.
I was awful. And so
I had 3 in the green that I had never even heard of. And now I'm currently on one of those, but I just never knew about because they're not one of the ones
they're not mainstream.
Yeah.
Yeah. And it's this is where I'm like, oh my gosh, like I was like, well, that's what I'm like, well, probably I was also a teenager, but I'm like, that didn't do it. Lexapro didn't do me any favors. Like it made me a lot worse. If only we had that in the beginning. It's just
so like if people get on an antidepressant, I know this is one of most people's biggest deterrent from doing it, the weight gain. And that's not a myth.
Yes,
like,
and that is so real. So a lot of
gaining weight, are you on the wrong one?
It could be part of the reason. Okay. Yes. It could be that perimenopause is hitting you at the same time, or you're really perimenopausal and you're having all these symptoms and your doctor's put you on Zoloft instead.
Yeah. Well, I think that my husband, because when he first went on it, they put him on Lexapro. And I think, and he'll tell you this, I'm not divulging any information that
I'm not saying anything.
No, he gained like 30 pounds immediately. And no matter what he did, he couldn't get it off. And then
very true.
He was telling his doctor this, and then they switched him to Wellbutrin and it was much better for him.
Yeah. But a common thing about Wellbutrin, which we literally talk about all the time,
also gave me panic attacks.
Yes. So Wellbutrin is an SNRI, which is actually a stimulant.
Yeah.
And you go to your doctor and you're like, well, I'm low mood, I'm depressed, or I just don't have joy, that kind of thing. And then they say, and then you're like, but I'm also really anxious and I'm not sleeping.
Yeah.
And I'm having panic attacks. And then, but the doctor's like, well, let's get you on medication. And then you're like, but I don't want to gain weight. Or they think, God, I don't want a phone call about you gaining weight.
Yeah.
So they always put you on Wellbutrin. Wellbutrin is a drug that is for 100% depressive symptoms.
Yep.
No anxious symptoms.
Yeah.
I didn't know that.
There's a scale. So Paxil is like 100% for only anxiety.
Yeah.
No real depression.
Yeah.
So, but doctors are putting all of these anxious and depressed, like mixed.
Yeah.
People on Wellbutrin, and it might be helping their mood. It might not be helping them lose weight, but now they aren't sleeping.
Well, that was
Now
always
they're
the
having
problem.
panic attacks. Now they are freaking out all the time because they've truly been prescribed the wrong thing. Truly because the doctor's like, well, I know if I put you on Zoloft or whatever, or Lexapro, you're probably going to gain weight.
Yeah.
And you don't want that, and I don't want to hear about it. So
well, everybody kept putting me on antidepressants that helped with anxiety when I needed anti-anxiety that could help with depression, because I don't have depression symptoms.
Right.
I'm a highly, highly, highly anxious person.
Yeah.
So I need that, but everybody was giving me the wrong stuff.
Exactly.
Well,
And
I
it's
just
scary.
love that you, like, you're, all encompassing knowledge that you have around like the medication, and like as conservative as some people think I am. Like, I'm actually like quite the granola hippie that I'd rather do like diet and exercise or whatever.
And I totally promote.
But you
realize that they all are they are mutually inclusive, not exclusive. They all go together.
Yes.
Yeah.
If you don't need the medication, and you feel great, I will help you get off of it, or I will just tell you to stop it. And if there's something I can get rid of, I will. And but if you need it, I'm not going to give it to you.
Yeah.
I'm not going to be like, oh, just meditate and you have severe depression.
Yeah.
Like sometimes people can't just meditate. There are certain people, you just have a chemical imbalance.
Right.
It's not your fault. It's not anyone else's fault. You just need something.
Yeah.
So you're going to be on something, but not everyone. That's not everyone. And a lot of people feel like, when we talk about the hormones and we talk about perimenopause and menopause, you're like, I have migraines.
Yeah.
I have joint pain. Well, here's a migraine medicine. Here's a neurologist who's going to put you on 3 pills.
Mm-hmm.
I have joint pain. Oh, here's a rheumatology referral.
Mm-hmm.
I have depression. Oh, let's get you to psych. Let's put you on antidepressant. I can't sleep. Here's sleeping medication. Oh, all of a sudden out of nowhere, my cholesterol's gone up, or my blood pressure's gone up, or my blood sugar's going up, or I'm gaining weight. Oh, here's cholesterol meds. Here are blood pressure meds. Here are weight loss meds. Here are all these things. Why did all this stuff happen in the first place?
Yeah.
Yeah.
And
then
you go to the top.
3 pills a day.
Yeah. And if you go to the top, it's your hormones. It really is.
And I think
9 times out of 10.
Yeah, I think it's kind of worth saying, like, I'm a big proponent of like finding root cause and not just management.
Exactly.
But at the same time, this is a life transition that is normal and natural. And so there is symptom management that needs to go into it.
Yeah.
Because, and somebody said something the other day that like women weren't meant to really live past the productive age. And so this is a time in our life where we're living past like what our bodies are.
So our bodies are like,
deserve to have an experience through that time that's not just white knuckling through it, that we can live these long
lives.
Yes. And so that does require a level of bringing something in and managing these symptoms
and finding the root cause.
And all we're doing is replacing, or all I do is I replace what your body is used to have but is missing.
Mm-hmm.
So I'm not adding in something new. I'm just giving it back.
Yeah.
It's like refilling your refrigerator. It's not like, well, my fridge is empty again. Like you go to the store.
Yeah.
You do what I do, get Instacart. Nice, my husband.
Like my ovaries are dying. I guess I'll just die.
Yeah. And people are like, I said, listen, our ovaries have not evolved to live as long and work as long as we are living and working. So we have to help. Now, does every single person need this? No. I mean, there's some people who just are genetically blessed.
Specimens.
They are specimens and they are blessed, and that is okay. Like I'm not, but
good for that.
Good for that. But for me, I'm like, if there's really something going on, like go to somebody like me or our practice, or find somebody who can listen to you. Find somebody who gets accurate labs, which is blood work.
Yeah.
No urine tests, no saliva tests. No, those are only urine tests are telling you about your waste. That is what you're peeing out. Your body's supposed to be peeing it out. That's the whole point.
Yeah.
But you're supposed to be seeing what is active. Yes, exactly. You are literally supposed to be getting your blood drawn. You're supposed to be getting it fasting before 9 a.m.
Yeah.
You're supposed to, you're supposed to be getting real blood work. Now, does your blood work shift? Like your estradiol levels are going to change. Your young estradiol, estrogen E2 or young good estrogen. That's what you want. That's what protects you against breast cancer, stroke, heart attack, bone thinning. This is the good stuff. It helps your skin, your hair, prevents UTIs, vaginal dryness, all these things. It's incredible. And it's something women need. But will it change with where you are in your cycle? Sure. But because we have enough time with you, we know where you are. Like, when was your last period? Okay, well, yeah, you are supposed to be lower. Oh, that was right in the middle. That's why your estradiol's high. You're ovulating.
Yeah.
They pay attention to the things that other doctors are like,
we have
just
the
not even thinking
time.
of.
We have the time to be able to ask those questions. So I don't worry so much about where you are, like, because your estradiol will fluctuate. But really, after 35, your testosterone goes down and it stays down. I don't care where it is in your cycle. It might come up like from 0.8 to 1.2, but it's not going to ever go above 15. So really, when you're in this perimenopause, you have this, your testosterone has gone from, cycling along with you to now it's down. But your estradiol is still doing this. But you don't have this testosterone level high enough to help you with the ups and downs of the rest of your cycle.
So this is doing this, but this is making
this helps even it out in perimenopause. And then in menopause, when we give you estradiol and we give testosterone, and we literally make you even. So that everything is just stable.
Yeah.
And you don't need to go really in menopause, you don't need to go up and down. Up and down is actually not great for you in that time of your life.
Well, I'm experiencing like significant crashes.
Oh, yeah.
Like a full week where I'm just like depressed, complete brain fog. Like I can't remember.
Before or after your period?
It's after. I think it's like the week after, but it's like I'll take a bath and then like an hour later I'll go fill up to take a bath again, and there's like bubbles in it, and I'm like, wait a minute, did I take a bath? Or I can't remember driving to drop my kid off.
Yes.
Yeah.
Or you're like, that was this morning, and it feels forever.
Like I'll go grocery shopping, and then I'll just like hit this wall, and I almost have to be like bedridden.
Yeah.
And it's just like,
it's because you don't have your testosterone in your system to protect you and to help you through your like where you are in your cycle. And it's so frustrating.
Yeah.
And people are like, do I have to retire? I can't even I'm in my 40s. Do I have to retire? I can't even remember the words that I was using.
Yeah.
I used to be able to work on 6 projects. I can barely get through one. The thought of I just get so overwhelmed. I used to be able to do this in my sleep, and now I can't. What is wrong? What's different? Why am I like this? And it's because exactly what you were saying. We have our hormone level, our bodies aren't meant to live this long. Our ovaries aren't working long enough. And so what do? We have to help
our bodies.
We have to help it out. Because truly, think about evolution, right? You're a caveman or a cave woman. You have babies. You are done having babies. You can't contribute to the tribe or workers anymore. Well, now you're just eating all the food.
Yeah.
You're not doing it. Yeah. Get on out of here.
Actually,
that's why we died so early.
A question I meant to ask earlier, and we did kind of bring it up, but we didn't get to talk about it. Because again, our generation, I feel like, is the first that started having children later. Like my first I had at 30, second 32.
Yeah.
And then third at 36. So then where our moms, their generation, except my mom had me pretty late, so minus her, but
minus my mom too.
Yeah. Well, I was a complete mistake, but that's a whole nother story for a whole nother day.
You were happy
and
a true miracle when your mom has her tubes tied and you still make it through.
You're persistent.
You're resilient.
No, but so their body, early 20s, they were having kids, and then their bodies had time to kind of let their hormones regulate before they hit perimenopause, whereas ours are they just having kids, and then we're still out of whack, and then we go into perimenopause.
Yeah, we're having kids on the precipice of going into perimenopause. So it's almost like they still had hormones, they still had our parents, or not mine, but other people's. When we're having your kids early, you still have testosterone in your system to have that get up and go, to have that motivation.
Yeah.
That's like when you see a young mom in your kid's class and they're signed up for 17
Yeah.
things. And they're like, yeah, okay. And this, and they feel like they have it all together. It's because they're younger.
Yeah.
So they still have some testosterone in their system to help them along.
Not all of us meet our person at 18 or 19.
Yes,
20.
exactly. And honestly, I mean, when we were in med school and I'm like, somebody would have a baby, you're like, ugh, like, they're like, oh, they got 2 months off. So nice for them.
Yeah.
That's how I feel about my
residency.
my kids now. I'm like, oh my God, I'm so, never mind that.
Yeah.
Congratulations.
Yeah. Like it is. I mean, I told you, my friend, I literally scheduled Evan's vasectomy the minute I found out that she and it's not because
I'm more,
but it's not like I'm like that baby's such a blessing, but it's not like,
no,
thank God out of our whole friend group, we have one baby and we all kind of, you know, when we're all together, we all help because it's one of those things where like, it's just, whew.
yeah. Cause my husband had a
for pushing
vasectomy.
through it too.
I know who, yeah. And like, she's a flipping rock star, but
yeah,
we were having this conversation the other day and because my husband got a vasectomy too. And I'm like, you better check that shit every year because I knew somebody, she was 44. Her oldest was, well, I don't remember. Her youngest was 12. I'll put it that way. She had 3 other kids. 44, husband wasn't getting it checked. Found out she was pregnant. And like, obviously, like, she's like, obviously I'm going to keep it. But like, she was like, I cried every day. Like, if I had even thought about being like pregnant right now,
your kids are finally independent.
I couldn't do it.
Yeah.
Yeah.
When your kids are finally like, don't need you 24/7.
Right.
And you don't have to wipe their butts.
And you're ready for that next stage.
Yeah.
And you're like, okay, like my body can become my body again. I don't have to share it with anybody else.
Yes.
And then it's like, oh my God, I have to do this again.
I will say with the vasectomies, get them checked at least 2 times after, because and have the doctor's office call you with the result. Because Evan,
oh no,
they were like, he did a sample and they're like, I go, so what's the report? I woke up in the middle of the night, like, panicked. First, I had like a nightmare. It's probably our friend having her baby. I was like,
yeah.
I was like, oh God. I was like, you had your vasectomy checked, right? He's like, yeah, remember, I did the sample. I said, well, what did the report say? He goes, no news is good news. That's what my doctor said. I go, what? She's like, and he logged into his lab app and it wasn't in there.
Oh gosh.
And the lab lost his sample.
Oh God.
Oh, I need to check. I don't.
And I was like, oh my God. I was like, you are going in the net like that morning. I was like, we're going to do it right now. He's like, the office isn't even open yet. It's 1 a.m. Like, and I'm like, I was like, oh my God. So luckily,
driving there now the clear parking.
But I'm like, oh my, I was like, no news is good news is not a thing.
Yeah.
News is news.
Yeah.
Like, good news is good news.
We need
another
confirmation.
Yes. You need confirmation. Oh, we need to talk about the other types of hormones.
Okay.
So we have creams and gels. So creams and gels, people apply either to their skin or like they put inside their vagina to absorb. What I don't love about them, first of all, when you're putting creams and gels in your vagina, and then you go ahead and that is a great way for it to absorb, but then you have sex.
Yeah.
Guess who that transfers to?
Yeah.
Oh.
Because it's transdermal, so anybody who
Oh.
touches it.
Yes.
Like, and if you're a kid, like,
Oh yeah, and you're
Does this happen from that?
it can.
oh
But
my God.
But men can get estrogen transfer from that. So maybe they
die.
and progesterone, and then they can get all this transfer. So then you're like, okay, well the men don't like that. Also, used to do that.
They don't?
Like, right? Like they don't like crying and having bellies and having.
Oh, I thought you meant this. They don't.
Yeah,
like
they shrinkage. The testosterone pellets though do help grow their penis length.
Yeah, there you go, boys.
So that's great. But then you're like, you have to apply it.
Yeah.
People say 3 times a week, but really daily is what you're supposed to be doing. And you're doing that every single day. Then gravity takes course. You don't want any of that. Then you're thinking about putting it on your skin, but just like, your body is not supposed to absorb hormones through your skin.
Yeah.
So you apply it to one spot and your body thinks you've walked by some poisonous plant.
Yeah.
And so your body starts shutting off what little receptors for hormones that it has on your skin. It shuts those down. So people say, well, I always apply it to my arm. And then after, it worked in the beginning and then it stopped. So then you start moving to different places. You move out of body parts. Those receptors they block for a very long time because they're trying to protect you from poisoning yourself.
I'm such a hivey person. I would break out in hives so fast.
And you also you have to think about kids, right?
Yeah.
If I was like, oh, well, I could have never touched my armpit. I mean,
They touch
my armpit
organs.
today,
Yeah.
and I don't even know why.
Yeah.
Like it's one of the, and then you transfer your hormones over.
Do you not have them?
Yeah, exactly. Like you don't, you and
Get 'em up.
yeah,
Yeah.
you get them up. You don't.
That's their own.
You will transfer to them.
Yeah.
Now you're affecting their hormones when that is not what that's the opposite of what they need. So that's something you really want to be wary of with these creams and gels. Then you talk about the shots. So the shots for men typically can work. Weekly shots can work for about a year, but shots are synthetic. They have so much garbage and so many preservatives in them. Even like the cleanest ones still have preservatives.
So would that be an example of a hormone, but not a bioidentical?
Correct. No shots can be bioidentical.
Got it.
Creams can be and gels can be, but it's
Can you repeat the bioidentical
it means
definition
it's
again?
identical to what your
You used
body
to have.
used to
Okay.
make. So
Okay.
if, like on a chemical, if you go all the way down
Okay.
to the chemical compound, it looks identical to what your ovaries or a man's testicles.
And so it's not
Okay.
being like synthesized in a lab, like you said, but
Right,
the
it's
pellets,
it's
being
naturally extracted.
If it's
Yes.
good for the bunnies and horses, it's
Yeah,
good
and
for
the cows,
us.
yeah. But of course, like we give it to them in a heartbeat, but like not to us.
Right.
But so we talk about creams. The shots, there is, I don't care who tells you there's a bioidentical shot. There's not.
Okay.
They might be mixing it with like for the oil, it's like in an oil. So they might have it in an MCT oil, like something that seems clean and healthy, but there's still preserved.
synthetic, yeah.
It's still synthetic. Testosterone itself is still synthetic. And for women, it happens pretty quickly. You'll know very quickly. Not only like, it's not like, oh, I'm having diffuse hair loss, like, aging hair loss or stress hair loss. Like you will literally have male pattern baldness.
Yeah. I
within
have it
about-
right here.
Within about, yeah.
Yeah.
Right here.
Well, I'm
So
excited to get your laugh.
I can't wait for you to go.
But then so they get that very, very quickly.
Yeah.
Very quickly within about a month of injections. And men so the first year usually it's pretty okay for them most of the time. But after that, they start noticing they're getting back hair, body hair, full body acne. They're going bald. They're getting bellies.
Yeah.
They're now all of a sudden becoming impotent. They can't like get it up. And you're like, why? It's because that's in your body. Starts catching on. This is synthetic. This is not what my body
doesn't
used to make.
belong in
This is
here.
a poison.
Yeah.
Get it out. So instead, it starts converting it into something called DHT or dihydrotestosterone, which causes acne, full body, acne, body hair, body acne, male pattern baldness. And then it also starts converting it into estrogen, which estrogen for men, you want some.
Yeah.
Some, because you need it for your bone density and you need it for like their skin and for them to feel any feelings at all. You want it. And, so you do want it, but you don't want so much that they've got bellies. Now they have erectile dysfunction.
Do they get boobs?
They get boobs. They're crying. They're more emotional. You're like, gosh, they're so irritable. They're so edgy.
They're like me.
It's because
It's like living with two of me.
Yeah.
Women want to know.
They want to know.
And this is a scary
It's a scary time.
Yeah. And like, the struggle is real.
Yeah. Yeah.
And then you feel like something's wrong with you. And then we're women. So we guilt trip ourselves. We mom guilt ourselves.
Yeah.
All these things. And then I'm like, it's a lot. And then people will be like, but like you have no reason to feel these ways. And I'm like, you know what? You're probably right, but that doesn't change the fact that I feel this way.
Yeah.
And I don't want to. And if there's a way that I can fix the way that I'm feeling, I'm going to do that.
Yeah.
And the fact that more and more people are talking about it and wonderful
amazing.
People like your mother and you are actually doing something about it is incredible. And
I have people who say, well, I went online and I answered some questions and somebody sent me estradiol and progesterone creams or pills. And I'm like, you
didn't even
36. Like, you don't need that. You're not in menopause.
There's these websites where you go on and they send you like your perfect pill in the mail. And I'm like, because I used that for hair loss and it didn't work. And I started reading the reviews.
Oh, yes.
And people were saying, this shit did not work.
Yeah, because it's a one for everybody.
Okay, so listen to this. So when you have hair loss, I do a couple things. So what we usually do, obviously, is we do a whole bunch of thyroid tests. We do your cortisol testing. We look at your dihydrotestosterone levels and some of your vitamin levels, because a lot of those things have to do with this. And we just talk about your stress in general. But if you're still losing hair, and we have a couple things we can get started, like just not even from testosterone replacement, just losing hair because of your age, right? We also have a genetic test that literally will do, it's a swab. We send it off and it literally tells you what would work for you when it comes to treating your hair loss.
No shit.
Yes.
Because I think this
Mine just started thinning.
27.
Yeah,
And so that means that you're genetically predisposed.
Yeah.
So what
That
do you need genetically? Like what in your genetics means that sure, we'll have to treat it with something. Is that a topical? Is that a pill? Is that a very specific vitamin? Is it a combination of all those things?
Yeah.
That test
take away elimination.
Yep. And it just does it.
Yeah.
And I have people like you who just have it's been a long time that you've been having that. Why don't we just skip to that test?
Yeah.
And let's just skip to the bottom.
Well, when you think of how much money you probably wasted on trial and error of things that it or you can just pay for this, do this test, and then you never have to get
stressed.
stressed.
Yeah. Didn't really try anything.
Yeah.
It's like,
Oh yeah.
when your husband's deploying every 6
Yeah.
months,
Like,
I was like,
he
that's
was
what
doing,
Yeah. And that makes perfect sense too. So that could be a huge part of it, right?
Yeah.
And maybe it's that and you have a genetic component.
Yeah.
Yeah.
Well, maybe,
I know
right?
that
So
kind of-
maybe
So
we
you
do
got
both.
double
Maybe
whammy.
But I
both.
didn't find out the genetic component until years later.
Yeah. And I think for some of these online things, sure. I mean, but really the things I was like, I had a guy, he's taking metformin for weight loss from them. And he was paying basically $15 a pill. And that is a $4. It's on the $4 list at Walmart. You can get 90 pills for $4. And he's paying so much money because he went to an online person. I'm like, can I just write you that?
Yeah.
Or people, guys sometimes still need some Cialis. They don't need it all the time, or they kind of get in their head. I've always needed it before. So if I don't have it, it's like their lucky charm.
Yeah.
But you're going to these online things, you're paying $6, $7 a pill when if you go to Costco or Sam's, you can get it $9, basically $9 for a 90-day supply.
Yeah.
I mean,
well, when you think
but all these things are get rich quick schemes. They've already been, a lot of these places have already been warned. A lot of these places have been shut down. A lot of these med spa, we added on a med spa. Truly, my mom will tell you, she was like, listen,
looks beautiful.
She truly looks amazing. But if I could, she's like, I want that laser.
Yeah.
I want that Botox. She's 74, or no, sorry, 72. But she's like, I want all that stuff. And all of our patients are saying, I feel so young on the inside. I feel so good, but I'm still aging.
Well, it's
and so we add that on, right?
Into all.
But then you have a lot of these places that are med spas and they're like, oh, well, let's see more stuff I can get from cash.
Yeah.
Let's do hormones.
Right.
Let's do that. And it's a pretty scary world, especially in Missouri. Well, a lot of states, but Missouri, truly. I mean, a lot of these places, they'll say, oh, I have a doctor reviewing. No, you don't. Well,
that's what I don't get.
No one's looking at labs.
No, well,
There's
the
no
amount
blood
of
work.
vials that you take when you go give blood for this, if that doesn't tell you right there that you're thoroughly being looked at. I mean, because even the lady comments, she's like, man, girl, this is a lot. And I was like, good, take as much as you can. Because
I have a lot of
want to
patients
look at
from
thoroughly.
the lineup, from Quest, who are my patients now, because they're or they send their wives because they're like, she actually does blood work.
Yeah.
You need to go to BioBalance.
Well, yeah. And so you'll sit there for a second and they'll take it. And it's like, you know what? I'd rather do 20 more because I know a doctor is going to be looking at it, giving me real answers about what I just gave you than going through a computer and talking to a fake doctor.
Yeah. And they're like, oh, well, we'll give you this. We'll give you this. Oh, we'll give you Botox. And then you can get your pills from the same person like that.
Yeah.
There is no physician oversight. Those are being signed off by some retired doctor who doesn't really care about his license. There is no one looking at anything. You're getting estradiol does not cause breast cancer. And there is an estrogen replacement, but there's certain things you have to look at and there's certain things that you have to manage and you really have to track. I don't want you to not get a mammogram and then I give you estrogen and then 6 months later you have breast cancer. Well, was it the pellets or did you have it this whole time?
Yeah.
I would so I have you get a mammogram if you're over 40,
and an ultrasound
and a transvaginal ultrasound. People say, why? And I say, listen, it is for your health.
Yeah.
Women's health is not looked at. There's a PSA. or your man's prostate.
Yep.
But
Yeah.
there's nothing to tell you if you have ovarian cancer. By the time you have symptoms, it's too late.
Yeah.
There's nothing to tell you if you have fibroids or polyps, what your endometrial
PCOS.
looks like. PCOS, yeah. Like what do you,
PCOS.
yeah, that is also a POS diagnosis. It sucks. Yeah. But it's
One of those
always-
things.
But I mean, I have people one of my neighbor, a lady who lives in my neighborhood. She was like, do I really need an ultrasound? My doctor's been giving me hormones for years. And I said, listen, it's in your best interest.
Yeah.
She went in for her transvaginal ultrasound. She had a giant mass in her uterus, and one of her ovaries was the size of a grapefruit.
Yeah. And she had no idea.
She had to have an emergency hysterectomy. Luckily, it was not cancerous, but if we'd given it 6 more months, it would have. We found so many things on women and diagnosed so many things before they even walk into my office.
Yeah.
Because I just care about your general health and your well-being. But sometimes you go to a doctor, they listen to you, they write stuff down, then they send you out for lab work.
That brings me
Then they
peace of
send you for
mind.
this. Then they send
Yeah.
now, like, I don't even, then somebody calls you and leaves you a voicemail. Everything's fine. Or you have to pay for another visit to come in. Why are we doing that?
Yeah.
Why don't we get all the data first?
Yeah.
Figure out where you are. Make sure you're still a candidate. If there's something that needs to be fixed right now from a structural perspective or something that's wrong, let's get that taken care of. Let's value your health.
I'm so weary of any doctors or really anybody in any field that is treating human beings like it's a one size fits all
Yeah.
approach because
And-
it's so unique to each
Each person,
individual.
right?
So I can clock that really
Yeah.
quickly.
Yeah.
And then I'm like, I'm out of here. So
Yeah.
I really
And-
love, and especially you taking the time, an hour and a half,
Yeah.
whatever
Yeah.
is needed to sit down
Yes.
and really
I love it.
encompassing picture of this
Yeah.
individual.
And I know so much, and those help me really get to know you. It really helps you have faith in us. Dr. Robin does them too, consults as well. It really gives you, it helps you understand yourself. It helps you be, know that you have somebody that you can talk to and you can listen to it. Like somebody was like, oh yeah, a patient yesterday, she's like, yeah, what's crazy? Last week, I started to have more mood swings. I was like, yeah, because you just got your first round. I don't give you a huge dose to start because I do lowest effective dose.
Yeah.
You don't need a big dose. I'm not giving you a big dose.
Right.
So in the first round, you might feel like your symptoms are starting to return. Well, great. I'm seeing you next week. It's okay. And, we
Well,
can
you've got to
adjust
start
your dose.
baselines.
Yeah,
where
and
you
we
are,
start- and your starting dose is not the same dose as, my patient who's, 250 pounds and 55 years old in menopause and who is being treated for diabetes and thyroid medications and is on 3 antidepressants and mood stabilizers. That's a different dose than you.
Yeah.
But there are a lot of these places, they really don't know what they're doing.
You
They want to
honestly,
try to make money. They want to make money. And so they just,
Yeah.
you give people validation.
yeah.
Because
You're
I was
not
like,
crazy.
I'm not
This is
crazy.
real.
Oh
Yeah.
my gosh.
Yeah.
There are actual medical answers and
Yes.
physical answers.
Yes.
I'm not a basket case who's
No.
losing my mind that's going to
It's
wind up
true.
in a mental hospital.
This is something that we
Yeah.
can fix. So cool. And I love when people bring in their husbands or their
Yeah.
wives to their consult.
I was just talking to Heath about this last night and kind of like what you were saying about your kind of journey with your husband and everything. And I was telling Heath, if I had cancer, would you research and look up ways to support me through that? And he's like, of course, yes, and it's but men don't do that during this stage.
No.
And it
You're overreacting. You're
causes
oversensitive.
confusion
Yes.
and it causes
Mhm.
resentment and it
Mhm.
causes, and it's I don't necessarily need you to do anything, but understanding what I'm going through
Yeah.
is not just helpful for me, it's helpful for you.
Yeah.
And so
Yeah.
Oh, it's helped our marriage tremendously.
if we had anything else that was medically wrong with you, I
Right,
think
yeah.
your husband would do the least bit to try and understand.
Yes. If you
what
had cancer, you have diabetes
Yeah.
or you
Or-
or
Well, you got to think that their
Exactly
moms, they're probably thinking in their head, well, my mom never complained like this. Well, I love you and I love that generation, but just because they didn't have the answers and they went through it and sucked it up and put on a happy face does not mean that I have to, because there are answers and I don't want to. Bless their hearts for doing it, but no, thank you.
Yeah.
I don't want to do that.
Like back then, like we were still like, you're drinking, you were still smoking restaurants.
Yeah.
You could take, Quaaludes were still a thing. You know what I mean? Like these are like,
Bring Quaaludes back.
you know what I mean? Like they had a lot of things that were very highly acceptable. They're clearly not healthy.
Right.
It's a quick fix.
Yeah,
exactly.
because I did the same thing when I would drink. It was a temporary Band-Aid.
And it's not
I
going to
quit
help
drinking too. It would help in the moment, and then the
not
next
long
day, everything would be worse.
But also
certain
the boomer
short in your life.
generation and our parents' generation, that was the one that started the divorce boom. So maybe that type, maybe they did just suck it off after marriage.
But think about the nutrition before that. Like all the generations before weren't getting the preservatives, weren't getting the microwaves.
And it seemed like, they were eating a lot of red meat, but like that red meat was very well sourced.
Yeah.
They maybe not
those
eating a lot of
cows
vegetables, but those vegetables were very nutrient
being
dense.
full of.
They also had children younger, and so they had a longer, time where they felt normal. They weren't having their kids and going straight into the
cleaner air. Their food wasn't sprayed with chemicals.
Yes, there were so many benefits to like everything was just cleaner and better.
Yeah.
So apples to oranges.
Okay? Yes, it's truly. Also, I'm like, their house was like $5.
Yeah.
And look, we don't have to suffer through this
just because other people did. That's what I'm saying.
Yeah.
Do you want your daughters to have
to struggle or feel like this?
Like,
no, absolutely not.
Let's move this in a positive.
And I told my daughters about I'm like, I'm so open with them, probably to a fault. And I'm like, look, you know why I get like this? It's because of this and that. I'm not a terrible mom. I love you guys so much.
Millennials are changing though. We're the first ones to
cycle breakers.
Openly go to therapy and talk about their problems. And like,
you don't need to be ashamed of your problems because guess what? Everybody has them.
Yes. Yeah, exactly. You're exactly right.
You're allowed to be human.
You're allowed to
You're allowed to be real. And I tell Kate, like my daughter, like, if like, something doesn't go well in a day, or she's like, oh, I thought you would know how to do that. Or I'm like, listen, this is my first time being a parent.
I say
this is your first time as a kid. This is my first time as a parent. Like, we're all not going to know everything right away.
We're learning this together.
We're learning this together. Like, not everything can be perfect. Yeah. And what we need to learn now is how to recover. Sometimes we just, and we have to all give each other a little bit of grace. But also, if there's a problem, we can fix it.
Yeah.
And so it's like, it's worth it to really value your health and value your longevity. And so I tell people, I'm like, obviously, I can't predict how long you're going to live or anything like that. But I want you to live however long God tells you or has written down that you're going to live. But I want all those days to be well. I want those days to be disease free. I don't want you, sure you live to 100, but
I don't want to replenish this.
The last 15 years of your life, you didn't even know who you were. And you were, in a nursing home wearing a diaper. Like that's not a life to live. Like that's not something. I'm like, why? This is something we have to really look at and really think about. Like, do you really need all of this stuff? Yeah. Is this really going to improve your quality of life? Is this really going to make you live longer or make you live a healthier life? Probably, a lot of these things, probably not. And how do we know? Well, why don't we, instead of getting you just on ancestral medicine, why don't I do a coronary calcium scan? Why don't I actually look at your heart for plaque?
Yeah.
It's so easy.
Ooh, I want to do
It's $99. It's so cheap. It's so easy.
No, I don't. I have an irregular heartbeat.
Oh, you do?
But it's great. And you'll go to your doctor.
I know. I'm not proud of it. It's very scary.
That's why like this hormone stuff, it's not FDA approved. Okay. Well, it is. Like the black box warning has been, reversed, but testosterone is not FDA approved in women. Yeah. But FDA pellets are, like FDA has approved pellets for men.
The FDA is FDA approved, I'm going to side eye.
Yeah. Exactly. Yeah. And so now I'm like, well, the pellets, there are some pellets that are FDA approved for men.
Don't trust them.
And they only allow you to have enough that would be basically what I would give a woman.
Yeah.
So it's not enough. And it's all synthetic. Not all pellets are bioidentical. Some are micronized, which means they're synthetically made, but they're put into a pellet. So it's kind of like a wolf in sheep's clothing.
Yeah.
So a lot of these big companies that are nationwide, they're not actually, and they might even have bio in the name. They might actually not be bioidentical.
Yeah.
If you really do enough of a deep dive, you're like, okay, wait.
CDC and the FDA.
Yeah, get out of here. Kick rocks. It's crazy. But the CEOs are worried about the now. They're not worried about the future. So we also offer, and we have since like almost the minute it came out, because I was begging for them to bring it to our office. It's called a Gallery cancer screening, like GALLERI. And it is a blood test that looks for over 50 types of cancer. I've been meeting with this incredible guy that works at Pernuvo. He's come to St. Louis. I've given him multiple places for him to be able to basically bring a Pernuvo, which is a full body MRI scan.
Is that what Kim Kardashian did?
Yeah.
Yep.
And he's talked to bottom. And they also have some blood work that you can add with it, but I already do all those tests anyway.
Yeah.
And then but a lot of doctors are putting the Gallery cancer screening with this scan at the same time, in order for them to be able to use a machine that costs, I believe, more than like $2 million in the state of Missouri. They have to pay an insane like tax or permit fee that makes it financially irresponsible for them to allow Pernuvo here in this state.
Yeah.
So now I'm like, okay, can you go to KCK? I'm also Columbia, Illinois.
Yeah.
It's right over the river.
Yeah.
It's really not that far. And I'm literally like cold calling people with large parking lots. Like, please, would you allow me? And if you own a large parking lot, they pay like to set this up. Truly, they will pay they'll pay like you need a special type of electrical thing. So they pay for that.
Oh,
they pay you rent for your parking lot. They will pay the electrical bill to use. They have everything available. You don't even need to use their property, like your buildings. They have a bus that will do the MRI. They'll have a bus that sets up like a place for you to change, check in.
I'm just sitting here shaking my head being like, why are you forbidding this from happening?
And it's like, oh my God, I literally am so mad because I like cried.
And you shouldn't have to pull teeth to get this type of care.
Yes. And he was like, when they'd be there for 4 months, like we'd be able to get people in. They literally could run, as long as you have somebody, a tech there, they could run essentially 24 hours a day.
Wow.
7 days a week for 4 months straight. How many people could go? And it's really not that expensive.
How many lives would you say?
How many lives
just
would you
one
sell? Yeah, exactly. And it's so disheartening and makes me so sad for this state because we can't offer this. If I had the Pernuvo, that's much more cost effective because they do it all the time. Yeah. That is what they're built for. So it is going to be a lot less expensive and it's a lot less crazy to do it. And I love the Gallery because the Gallery will literally be like, looks for over 50 types of cancer and it looks for them at this cell. They literally look for cancer cells. So when we're talking like pancreatic cancer, sarcomas, things are very highly aggressive. And so I have patients, if they have a strong history of cancer or they've been they basically lived by Coldwater Creek or grew up in North with all this nuclear waste, all this nuclear exposure. A lot of my patients are getting these Gallery cancer screenings every single year. They do it once a year, and we can always do it and can add it on or do it twice a year if we need to.
Aaron Brockovich.
Yeah, and exactly right. And then if say you don't have any cancer history, you're just trying to be healthy, and there's nothing wrong with your labs, and there's nothing scary. Like we're not worried about anything, but you're just trying to make sure you're your best self in a changing world.
That's what I mean.
You get the Gallery cancer screening every 2 years.
Yeah.
Every other year. Like one thing where you're not, it's not like, oh, well, I'm extraordinarily at high risk or everybody in my family had a cancer of some sort and there's no right.
You also, if you want to get like crazy with it or think, like my youngest has autism. And so there's a lot in the community that are nonverbal and they grow up and they become adults or, and they can't necessarily describe or tell you the symptoms in their
and that's so
teenagers
scary.
or adults. And it's like, all you have to do is just make sure that they have this thing.
The right testing. Mold and mycotoxin testing is unbelievable. I've been started checking for people. I'm one of those people, if you're
mold in the body.
Are you releasing this thing? Yes. Mold in your body and your blood. Are you releasing this thing? Are you doing this right away? Did you find a place for a GLP-1? A compound? I'm like, I don't jump on anything right away because if I'm going to use a compound, if I'm going to use a blood test, if I'm just like, I need to make sure it's accurate. I need to make sure it works. I need to make sure that we can actually treat whatever we find. Yeah. Because I want to make sure it's safe. So all of these things I do before we release it. So I train for this mycotoxin testing, for like over 2 years
Yeah.
before I really had like a really great wrap around it, really great knowledge, really knowing, and I could really train my staff to really know, and my nurses, my nurse practitioners, my PA is great. They're fabulous, but really trained so that we are very knowledgeable and can treat it. But mold toxicity and mold exposure is unbelievable. And it is
I have a
killing
friend
all
that
of
just
us.
did it, and I read a lot about it, and I'm like, shit, I want to get
It's killing all of us.
Yeah.
And it is directly associated with ALS, MS,
Yeah.
autism, acne, depression, anxiety, autoimmune disorders, Hashimoto's. There are like just feeling not like yourself, despite me running all your labs and you're
Literally feeling there's like
what's-
something in you that shouldn't be.
Yeah. And so, I mean, that is incredible. We, this physician that trained me, he constantly, every time I talk to him, he's like, this is a kid who literally never spoke.
Yeah.
And we got him tested, and which is hard with a kid who, you know, is with autism, it's hard to get blood drawn. But 2 vials of blood, very, you know, find out what it is, find the source, treat the source, do the treatment. And the things that they're seeing with these kids are truly life altering.
And then they're able to treat
I
it.
mean, like,
Yep.
think of
They
that.
say their first words.
Like,
they
I've
talk, they
heard
do all
that.
these things.
But
that
like,
they
if you
never,
think of what like penicillin is, like, or
I know.
you know, and it's like that is a
Mold.
very strong, like,
Mold.
yeah, like antibiotic, but
Mhm.
also like that's a very, you know, like if you do just have this crazy outbreak of mold and you have that in your system, and it's like, what is that?
And then
Breaking down or, you know?
yeah. And then you think like, well, why is autism on the rise? I'm
Yeah.
sure I'm not going to get on the whole vaccine thing, but there's clearly something going on.
Yeah.
And I like what I did with Kate with the vaccines is I was like, I'm not anti-vaccine. I'm none of that. But like, how does my 8-pound baby get a full-blown immunity to 6 diseases all at the same time? Their immune system isn't even developed yet. How are we doing that? So literally I had to pay extra, whatever, to space them out every 6 to 8 weeks.
See, I didn't even know that was an option. I was
They don't even offer it.
Again, a one size fits all approach.
I know, and I
I'm
look
like,
back and I'm like, I really wish I didn't.
It's
say
truly
yes.
about government, like how to medicate patients and what does it cost to do extra, and it costs the government so much. So then they think, well, what can we safely put together, or hopefully safely put together?
A protocol.
So and so I've spaced out every single one of her vaccines. Basically, she wasn't getting more than 1 shot at a time. Obviously, MMRs altogether, but like I didn't do MMR and Hep B or Hep. I didn't.
Now they have MMRV.
Oh, I know.
I didn't. I wish I knew.
So I spaced everything out. I paid $35 extra.
And it's that I would,
but it doesn't even offer it because it's cash. Like these coronary calcium scans for heart disease, nobody even offers them. They're $99. Well, your insurance won't cover it. It's $99. Like for somebody who everyone's dropped dead of a heart attack, that would be something very beneficial to them.
No, I'm into it.
So all this stuff. So with that, like, yes, the autism thing. Yes, I believe there's probably some link to just overdoing it all at once in very
some systems can handle it.
Yes, and some can't. Exactly, because we all have different genetics. Then we talk about mold. Well, why all of a sudden is mold toxicity a thing? Mold, autism rates and neurologic disorders rates have really skyrocketed with what a lot of people call the indoor generation. It wasn't a big thing way back when. Yeah, they didn't have preservatives and all this stuff, and they're, sometimes they ate moldy bread, but your stomach and your GI tract actually can protect you from that. It's not about what you're eating. It's about the air that you're breathing. And there is no filter in the world that prevents mold in your air. We all have basements here, right? Like we all and if we're sitting inside and we're not keeping the windows and the doors open and we're not forced outside of our house, 6 to 8, basically for school, and then you're outside until you get until the street lights come on, like what my dad.
Good old days.
You're inside, you're playing video games. You are, hanging out, you're watching movies, you're doing projects inside, you're using the air conditioning because it's hot as hell here in the summer. Like you're inside. This air is just constantly recirculating and we are constantly and you get one mold spore in there and you get more and more. We are constantly breathing it in. And at some point our body just can't fight it off.
What do you take? Like if somebody has a high level of mold, what is?
Well, so there's a lot of steps to it, but the big one is finding the source. Where in your house are you getting exposed? And it's in your air. and I have a whole protocol set up.
So there are different types of mold that'll tell you where it's coming
Yes,
from.
where it's coming from, but also just like use your like your basement, check your basement.
Yeah.
Check your bathrooms, check places where you've had water damage before, or where you've seen water coming in, where do you have water spots? Check all that. Check your air. If your air is like with these air tests that I recommend that I don't sell, but it's called gotmold.com. If you go on there, they do these air testing kits. And if you have even a mild to moderate amount of mold in your air, you need to have a real expert come in, find the source and remediate it and truly get rid of it. Sometimes that can be costly, but what's your health worth? What's your longevity worth? What is all this worth? And sometimes your house can be so bad, you just need a new, like you have to get out of there and get to a new place. Sure. And sometimes that's scary and it's a scary thing to think about, but do you
really want to be living in that?
Exactly.
Well, I really want the audience to know if they're watching this and coming in and they're like, I've had mold in my house. My child has autism. I'm having weight loss. Any of the topics that we've talked about, Rachel and all they have to do is go to
BioBalance Health.
BioBalance Health. Okay.
Click become a patient. Then there's a questionnaire that you fill out and you fill out the entire form, sign and submit. Then my nurse, I have a couple nurses because one of mom's on maternity leave right now, and she's the cutest little baby boy. But so I've got a couple nurses covering for her, but one of my nurses will contact you and say, hey, I've seen your questionnaire. Now it's time for you to get blood work. And if you're over 40, I need your mammogram. And a woman, I need your mammogram and your transvaginal and I would like to get a transvaginal ultrasound on you. Here's some orders. If you've had, whatever, we can kind of go back and forth on what you've had done and what you need. And then once we get all of that back, then we schedule you because we don't like to waste your time.
Yeah.
I don't want to waste my time. I don't want to waste your time. And also that does, and also like if you're kind of like half-assing it, like if you can't get through the questionnaire and you're like, I don't feel like doing this, then you probably don't need to be my patient, right? I need people who are committed. I need people who want to be well. I need people who think, this 20 minutes of filling out this questionnaire is worth it. Because I don't feel well and doing this is worth it. I need you to feel, they should be as well. And, sometimes people are like, I don't want to do that. Okay, that's fine. You're not my person and I'm not your person. If you want to go down the street to the same place that that does your Botox and your injector can put a pellet in your butt and you walk out and you don't care one way or the other what you're getting or if this improves your life long term or decreases your disease risk, go for it. You don't need to be our patient, and that's okay. Like I am fine with that. Like I want you to do what you think is best for you, but I want patients that we're in this together and are committed. And I want people where 10 years from now, I still know everything about them. I still even if you're not seeing me and you're getting blood work drawn with my nurse practitioner, I know what's happening to you. I know what's coming through down the thing. Your nurse practitioner's recommendations are mine because I looked at them and I reviewed them and we've discussed them. So it's not like
and you actually care.
And I actually care. I do. And we all really care. And it's one of my nurses love it.
They're amazing.
I have great longevity, very low turnover because my staff and my nurses love it. They also get free pellets, but it's part of their it's part of their bonus structure in their employment, but if they want it. And then they love it because they love what they're doing and they like seeing well people and they like seeing well people who when they do get sick, we know what to do and we know how to help them. And we do. And if sometimes things happen, I can't say you're never going to get cancer as my patient. Right. I'm not going to say you're never going to have diabetes and be my patient. I'm not saying you're never going to have depression or ADD when you're my patient. But what we need to be able to do is help do anything to mitigate those symptoms or get you to the right person or fix what we can fix to make sure you're living your best life.
Less likely to fly under the radar.
Exactly.
We will link all of Rachel's info to get to BioBalance on the show note episode or episode show notes. And
I'll give you all of our Instagram handles.
And then your mom's book as well.
Yes, and our mom's book.
Is it on Amazon?
It's on Amazon. There is also a men's book.
I got one.
And it's called Got Testosterone? Question mark.
I know a lot of guys that could probably.
Yes, and that talks really in depth about about shots versus pellets versus just for men. This also talks a lot about the hormone replacement therapy. And what I like about this one is my mom's whole case was pretty extreme because she had a total hysterectomy. So she
Yeah.
went from having a little bit of something to absolutely nothing in
Right.
one night. But so I would say it's pretty, it is pretty extreme, but these are all true things. This is a very extreme, but
And a lot of women have to have full
yes. And you could say like, wow, that was me.
Yeah.
Or you could say, oh, well, it's not, luckily I wasn't that bad. Okay. That's fine too. Like, but it should really relate. And it's it's a really wonderful experience, but it also has a lot of science in there. And it's a really, really great read. I'm more of a talker versus a writer, so I love it because she has HealthCast as well.
Yeah.
So she does all of that while I'm seeing patients. And she writes the books and she does the blogs and, I give her topips. I'm like, hey, we should talk about
phenomenal cocktail dresses.
Yeah. She wears such cute outfits. One person one time told her that she was wearing the same outfit from episode 5 to episode 300. And she was so distraught. It's like a whole thing.
Never doing that.
So she'll never have a double outfit.
No, I've never once seen her in this outfit.
Yeah. But it's really cool. And obviously I love what I do and we all love it.
Again, just such a pioneer. And then you're picking up right where she left off. And it's help beyond help. It's actual help with care.
Yeah.
And I mean, as cheesy as this may sound, but there's love there.
Yeah, truly, that's what I also love about St. Louis. It's like,
yes,
it's like the 6 degrees of Kevin.
It's the
it's like the 2.
It's the. I was gonna say it's like 2 degrees.
Yes,
and the whole question in and of itself. Where did you go to high school? Like people would be like, "Oh, it's such a judgy question." I don't think so. I always use it to be like, "Who do we know?"
Yeah,
because I know, if I know where you went to high school, then I can be like, "Oh, so you probably know blah 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 blah," or this person or that person. So I mean, I never use it for judgment. I'm like, who do I know? Yeah, it's a way to
connection thing, and
let's see who we know. And then I mean, also I don't think you can walk into any building in this city where maybe you don't know somebody personally, but you absolutely know somebody that somebody in that building knows intimately in some way.
Yeah, absolutely.
Wow. Big small town.
I think this was amazing. I think so many women, I was looking at our analytics and most of the women who, watch the shorts or the reels in Missouri are from 34 to
no, this is gonna by far.
And so they're all kind of in that range right now.
Mm-hmm.
I know I'm still going through a lot of changes, but it does help to feel relief that there's somebody else there.
Wait until you sit down.
I have no doubt in my mind I'm going to be running to your clinic, and thank you so much
honestly,
for answering
and
sharing your knowledge. And I want to get to the fun part.
I want to have her back. We could do literally
do question or
shorts.
Or not.
If you have topics or anything you come up with or anything you want to deep dive more into, I can
for sure. Because I think it's just so helpful.
So let's get to the wrap up quick fire questions. Our fave part. Did you get to look at these?
I looked at them a little bit, but then I also kind of wanted to just,
be surprised to have an authentic answer.
Yes.
Question number 1. If you could have 3 dinner guests, living or dead, who's coming to dinner?
Okay. So, I was talking about this with Evan last night. I was like, he was giving me all these he's like, Marie Curie. I'm like, he's like, what about, he's like, what about the Pope? I'm like, oh, so truly, if I'm going to dinner, because I work all the time and I'm parenting, I'm trying to have fun. We've had dinner.
Yes.
We literally just laugh so hard the whole time. That's always my goal of a dinner.
I have a feeling I know what she's going to say.
So, I would say, Jason Segel.
Oh
my Lord. I love him.
Yeah.
I laugh so hard. I also would feel like we need a karaoke night with him afterwards.
Yes.
some like Dracula musicals and stuff. I love all that. He's the best. Yes, exactly. Literally one of my top 5 favorites.
Yeah.
And then I would also, I mean, honestly, I have a couple friends, like, so Annie and Marlise.
Oh, I love that you're picking people that you are.
They're going to be together. But
Yeah.
we literally
Annie and Marlise are one person.
Yes, so Annie and I have been going
They're
to
not,
school.
they're
Okay,
two.
no, but we've been going to school.
They went
Annie
to
and I went
MSC.
school together since 3rd grade. And then Marlise and I were 7th grade. I think, don't at me if it was 6th or 8th, but I think it was 7th.
Annie is also married to one of Al's best friends, Bob, which is how I know. And then Marlise, oddly enough, was my little cousin's boss when they were selling, I can't remember.
Moni.
Yes, who lives in South Carolina. And she's like, how do you know Marlise? I'm like, how the fuck do you know Marlise?
She's truly the best.
See, again, 6 degrees of
Yes.
Yeah,
We
exactly.
laugh. I mean, truly, we laugh so hard. We have so much fun at dinner. And like, I mean, we could all talk for hours.
Yeah.
It's the best. So I put them together because it's just like a friend group. But then, you know who was Joan Rivers?
Oh my God. Okay. I
Who
thought
are
you
you
were going to say Dorinda, but
Oh my
Joan
God.
Rivers would be really
Joan
good too.
Rivers.
Yeah.
Yeah.
I feel like
Yeah.
she would she put a lot of truth bombs out there, but she'd be so funny.
I love the
And they're
But
user-
Dorinda would be fun.
Dorinda
would be great. That's another.
Yeah.
Well, that's what I was thinking.
Throw Marlise and Annie
How
out of
are you
there.
doing
I'm just kidding.
Not well, bitch.
Yeah, like that would be. Those would be like my tops for
Yeah.
sure.
Yeah.
Oh my God, I love that.
That's yeah. And yes, those are perfect. I love though that you did actual friends.
And you're
Yeah.
here for a good time.
Yes.
Now you're
Yeah.
Yes.
I'm working so much.
Yes.
Because I did pick very serious people because I was thinking like, okay, I want to get as much knowledge out of them as I can.
Yes.
But when you're thinking about it,
I mean,
just
like,
wanna go to dinner and have
yes,
fun.
like, yes,
Yeah.
I like, sure, Pope John Paul.
Yeah.
Sounds great. I would love to learn some stuff.
Yeah.
I was like, you'd ask him what was in the basement. What's going
yeah.
on?
Well, I one of mine was good old JC.
Yeah.
Jesus Christ.
I was
It's like,
thought-
is it really true?
yeah.
is it all really real?
Yeah. Or like, tell me exactly what happened. It's like,
Yeah.
you really knew?
Yeah.
You know, like,
Your mom,
did you really?
is your mom really a virgin?
But for me, I was like, were you all really eating on one side of the table
Yeah.
for the last supper? Or was that just an artistic, rendering? Like, things like that where
Yeah.
it's like, I'm like, just correct. Like, I just feel like there'd be certain things.
So how did you really feel when you found out about Judas?
Like, were you like, I was like, that was like a dinner, like a Real Housewives dinner.
Yeah, they needed something in there.
They
Someone's
just
here.
needed what's her face with the electronic.
Yeah.
Oh my
All right, this is
Yeah.
my favorite question. I designed it.
Oh, okay.
It's my favorite. If you could insert yourself into a movie scene, what would it be? It's like I was like one of the characters in the scene and like really vicariously lived that scene. So any movie scene.
Okay. Okay. Well, I have 2 with Jason Segel.
Of course.
Okay. So forgetting Sarah Marshall.
Yeah.
When they're at the bar with the Dracula musical, I just think that would be just so amazing to watch, but also the shock in everyone's eye. Like everyone would be caught off guard with that.
Yeah.
I think it would just be so amazing to experience and to watch. And then also, if you've seen the movie I Love You, Man.
Yes.
Have you seen that?
Yes.
Where he's like,
I feel like
the best
enough
man.
people don't know about that movie.
Oh, totally.
Yeah.
You need to see it. It's so good.
Yeah.
But I
Al loves
love,
that.
oh my gosh, what is his name? He's from Kansas City. And
Paul Rudd.
Paul Rudd.
Yeah.
God, he's so hot. But Paul Rudd, I love him.
Mhm.
I love how awkward he is and all these.
Yeah.
And he's like, what's up? Bro, name it. Like, he can't use his words when they're like,
Well, that's how he is in Sarah Marshall too. Because like,
peace.
P.O.P.
P.O.P. Yes. He told
The
me
weather outside is
weather. Yes, totally. When he said, he goes, when life hands you lemons, you say, fuck the lemons and bail.
Yeah. What was the other? He's
so fun.
I could.
He's so funny. And honestly, if I could be in any scene if I could be in all of Clueless,
Yeah.
I would be in all of
That was
Clueless.
his introduction to
Oh,
Yeah.
so good.
Yeah.
And I guess I should have said I would have had dinner with Paul Rudd because I really like Paul Rudd now.
Well, you did Marlise and Annie.
Yes.
You can do Jason Segel.
Yeah.
Oh, Paul Rudd.
And
Okay,
Paul Rudd.
perfect. Thank you.
Yeah.
But any scene in Clueless, I would be obsessed with.
Boom.
Yeah. It's like, why learn to parallel park? Everywhere you go out to LA.
Yeah.
So Kate was like, why learn to learn? Why learn how to count pennies?
Yeah.
She's like, they're discontinued.
Yeah.
And we use credit cards.
You're not wrong, Kate.
And I was like, I know,
You're
but
not wrong.
let's just finish your homework.
This is so good. They clocked Radiohead before everybody.
Yeah,
knew
so
Radiohead.
good. Wow, wow, wow.
Is this your, what does she call it? Your post, oh no, that was Dion. Is he in his post idealistic phase?
Yeah.
So good.
All right, your turn.
Oh, okay. Um,
Third one.
if you're taking out of town
Oh.
guests to a dinner spot in St. Louis, where are you going to dinner?
So truly the number one spot is Olive and Oak.
Yeah.
Okay, somebody
I
else said that.
And
Heath.
I'm obsessed with Olive and Oak. And
They both live in Webster though.
we live it, yes.
There you go.
And
Yeah.
their
Nice.
owners are just such great people. Like they're just so great and they're so philanthropic and the food is so good. And also my husband literally judges every restaurant based on their burger.
Their
Wow.
burger
And
See, Keith said the same
is,
thing.
oh my,
so good.
it's
And
so
the
good.
kids
So
meal comes with the burger.
Yeah.
Oh.
So Kate gets the burger and then she doesn't always eat all of it.
Yeah.
And then I get a half a burger.
And then mom and dad get it.
It's
No,
Yeah.
it's, you're guaranteed phenomenal food. Not
So
not
good.
just a good meal, phenomenal food. The atmosphere is great.
so great.
That like it is,
And
I've never once been in not
I've never had a bad meal or bad service.
Maybe I'll leave
Cocktails.
the Billy's.
Yeah.
before, while I still have the cocktails off the chain.
So good.
Oh, it took
And they
a
have
while.
plenty of mocktails.
They
Like,
do?
really good mocktails, tons of non-alcoholic options.
Yeah.
But I will also follow that up with like if you want to go somewhere really authentic, like really like just cheap, quick, and amazing. Because Evan loves burgers. So
No.
like past, 15 years of my life in burgers. Is Carl's.
Yeah. Earl's on
Carl's
Manchester.
on Manchester.
It's their diner.
It's a diner.
Yep.
It's cash only.
It's right at Brentwood and
Literally,
Manchester.
if you can't get in on one side to sit on one, like a set of seats or one
Yeah.
table, you have to go outside
Yeah.
and go around and come in on the other side to sit at the
Wow.
other bar.
Yeah.
Everyone's
It's old
cooking right in front of you.
The
and it's
root beer's amazing.
unbelievable.
Gotta take blame.
Yeah.
It's so good.
This burger is
Frosty
tasty.
mugs.
So
Oh,
Okay.
unbelievable.
All right.
So shout out to Carl's.
Yeah.
If you could do a job or career other than what you do now, what would you do?
There'd be probably two. So what somebody else would say about me, Evan said you'd be a stand-up comedian or you'd be a hostage negotiator.
Oh.
Sounds great. We were laughing about them, but I think I would plan like parties and events.
yeah, you would.
Like if the money was good,
Yeah.
Yeah.
I felt like I could still like
I
have
mean,
a,
As someone who's been to quite a few of your your parties are unmatched. They are
They-
beautiful. Everything is decorated. Like
I just love it. I love
it's
all the
just
details.
It
like,
makes sense
Yeah.
because you seem to have a lot of attention to detail.
Yeah, it
and that
does.
makes a great.
Yeah.
and it makes it for the best party. It's stuff you would never think of.
And
Like
now
with
I'm like,
cowboy hats.
oh my God, that was so cute. Yes. And now I have like a great, group of ladies who
Yeah.
helps me now.
Oh,
Where I'm like calling her, I'm like, hey,
Yeah.
party,
Yeah.
crazy theme, let's go. And she's like, we're gonna do this. I'm like, yes,
Yes.
love it. And then we've got like a little kind of thing going.
They're
I love it.
unbelievable.
I'm obsessed with it. But now I outsource
Yeah.
to the best. Bounce and bash.
yeah.
Yeah.
Yes.
No,
like
incredible.
that. That makes
Incredible.
a
Yeah.
lot
I
of
could see
sense.
that for you completely.
Thanks.
You just said that one. What is your favorite STL sports moment?
Oh my gosh, there's so many. Okay, so I will be fair. To be fair, I love Mizzou football.
Okay.
I've always been a Mizzou football
Yeah.
fan. I did not go to Mizzou, but both my parents did. I can't tell you how many bowl games I've been to, and I just love these games.
Yeah.
I still go down. I've met Coach Drinkwitz a
Mhm.
lot. Eli is incredible. He's so smart. I love the players. I love the coaches. Everyone's so approachable. I love going to those games and we sit like in a little whatever box. It's so fun.
Yeah.
And I just love the energy and the atmosphere. And I love
Atmosphere.
seeing these crazy college kids.
Yeah.
Cause I'm like, we were like rolling out of bed, like going to, like football, baseball games here in San Diego. Like we're looking cute, but not that cute. everyone is like
Oh,
dressed to the nines. They are. I'm like, this is a lot.
Yeah.
They're like, and I just love
Game day was a big
people
deal.
watching this.
To
Unbelievable.
storm the field at the
Oh,
Nebraska.
yeah.
So amazing.
But that was
Incredible.
incredible. We got in a car accident that day for flipping off somebody I was driving, flipping off somebody who was driving like
They were
an idiot.
Nebraska fans.
And then I rear-ended these two really hot Nebraska guys who pulled over in the Walgreens right at stadium.
A double
Yeah.
click and then ran into.
And by the end of it, we're all like hugging, and I'm like, I'm so sorry, your car, we're favorite.
I was laughing.
Yeah,
That is so funny.
but then we saw in
So-
the field later that night. So
Truly, any Mizzou game and any Mizzou bowl game,
I love that.
they're all tied.
Mizzou person.
first person to say Mizzou.
Yeah.
Oh,
For
Totally
favorite.
love it.
Okay,
Yeah.
that's fun.
when
Yeah.
we had a baby or little wait at the like or younger one for the Stanley Cup, so I didn't go to the Stanley Cup finals.
Mhm.
But I will say that someone in my neighborhood like shot off a cannon
Oh,
going on, and then somebody was like ringing.
I remember that.
The whole neighborhood erupted,
Yeah.
and I was like, you're home with a baby, like you're a
Yeah.
little one, but it was like one of those things. I was like, this is like it was
Yeah.
so cool.
Once every 50 years.
No,
Yeah,
because our girl is like
Yeah.
Kate's age, and I remember
They were little.
I woke up to
Yeah.
the boom, boom.
Yeah,
and
yeah.
We don't live that far. From
No,
each
yeah,
other,
we
and I
really-
was like,
Yeah.
wake her up. I was looking at the monitor, like,
Yeah.
she fucking gets up
Yeah.
right now. I was
Yeah.
like, go Blues! But
It was amazing.
I feel like everybody gets confused by this one, but I
Okay.
still like it because brings
Okay.
up conversation. Okay,
Love
so
it.
what is either a personal truth or a hot take that you're standing on? So, like, maybe something controversial that you're just doubling down on, or a
tips.
personal. Yeah.
I didn't just kidding. I know. I was like, oh God, I've already been like, space out your vaccine. Everybody has mold toxicity. Don't follow FDA. Every FDA rec. Like,
Yeah.
yes. I think it's always actually. So my friend Marlies, who lives in LA, her son is like picky, and they're in LA, everyone's just like so calm. And she's like, you have to be able to take like he won't eat something because he doesn't like it, but he's never had it. She's like, I need you to take a no thank you bite. So you literally take a bite, chew a swallow it, and you go, no, thank you. And I like if we go to dinner, like one of my big pet peeves is that if we all order something or we all want it, like it's something's new and somebody hasn't tried it before, they immediately say no. They're like, I don't want to try that. I don't like that. I'm like,
I don't want to go to dinner with that.
I'm like, try. You need to have a no thank you bite.
Yeah.
Yeah.
I need you to have a no thank you
That's
bite.
good.
Try it. Then you don't. I'm not saying you have to eat the whole thing.
Right.
Have a bite, chew it, and swallow it, and then tell me
And about
that you don't.
99.9 times out of
Yes.
100, they're like, oh my God,
It was so good. So no, I stand by a no thank
I-
you bite. I just did
that. Yeah, that's a good one.
I mean, I didn't have sushi or Indian
You were
food
such a
until
picky
my
eater.
20s, and it's like my favorite food.
It's so
You
good.
ate
Yeah.
Caesar salads,
Yeah.
chicken fingers, pasta. That was about it.
Yes.
And now I-
One of my best friends has that diet
Clock
or had
it.
it.
Yeah.
Yeah.
When my friend in med school had a salad for the first time, she called me. She's like, I had salad because she was like very into like
Yeah.
chicken fingers,
Yep.
chicken nuggets,
That's just how
fries. Like it was
what
just
I was
raised on. Yep.
And then met my husband.
See, I don't understand how
traveler.
my Margaret's a picky eater. Like Al and I we eat ever. I was never a picky eater, and like we're like constantly giving him stuff. And I mean, that girl lives on cereal. I mean, maybe in an Uncrustable now and then, or a homemade cake.
Kate is an adventurous eater. I will tell you one funny story. Well, her first food was accidentally caviar. When we were at like an event, and I hadn't had it in a while, so I had some. I was splitting with my mom, and she was there in a high chair, and we were not paying attention.
Yeah.
And she just reached over, grabbed the whole thing, and ate all of it.
I love it.
It was like a delicacy. Like, it was like once.
Was she even eating salad?
No, she
Oh
didn't
my
eat
God.
anything other than breast milk at this point. It was like she was like 3 or 4 months old. And she just ate the whole thing. I was like, but for some reason she's an adventurous eater. But they've been
Love it.
practicing for First Communion.
Yes.
But Kate, they tried the wafer and the wine yesterday. Did you hear this?
Yeah, I did. Margaret was like,
Oh.
wine is so disgusting. I was like, remember that.
Kate said, the wine's not very good, but I'm sure it's just because and she goes, I don't know why you like it, but you must just drink different wine. And I was like, sure. Great. And I was like, I'm sure she's told every teacher that. And
Yeah.
then she was like, the host is really good.
the first child I've ever heard say that it was good.
I was
I
like,
like
what?
that.
I was like, that wafer. She's like,
Yeah.
oh yeah.
Oh, good for her.
I was like, first
Yeah.
communion. She's so excited.
So
Yes.
if you came with a warning label, what would your warning label say?
My warning label would probably say, like, I will be like, I'm an insanely loyal friend. I really am. But if you want the truth, ask me, say, I want the truth. Because I will tell you, I'll give it to you. But if you don't want me to tell you the truth, or you're like, be easy on me, you need to say that. Because I'll just kind of tell you how it is.
I'll give it to you
That's
blunt and straight.
What?
I wouldn't want it any other way.
Yeah.
I would give it any other way,
Yeah.
and I wouldn't want it any other way. Like
Yes.
when I like people who wear their emotions on their sleeves.
Yeah.
Like you're never gonna have to. I'm never gonna be like, I wonder what Rachel's thinking.
Yeah. Like if I,
that's how I am. Like you don't ever have to guess how you know how I'm thinking.
yes.
And
Yeah.
love it.
Yes.
Love it. Love that about you.
All right, final one. Go
Okay.
for it. Okay, what's the best advice you've ever been given in your life?
Okay. So with raising kids or a kid, a couple parents who I know who have like older kids and they have really great open communication with their kids, and you don't have anything major, like when it comes to secrets or anything like that. They say the way they maintain open communication is that when their child comes to them and tells them something, says, I had a really bad day at school, blah, 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 blah. Tell you something. You sit there, you're supposed to sit there and listen, and then you wait. And then if they don't follow up with a question or something like, can you help me? Or something like that, you say, okay, thank you so much for telling me. You never get mad. If they tell you, even if it was a bad thing, you're not mad at them. And you find out that can affect the trust, but they tell you, if anything happens, you say, okay, here's my question for you is, do you want my advice or do you want me to listen? And do you want me to just support you?
Yeah.
What do you want? Because you can't live your whole life they tell you something and you're like, well, this is what you should do.
Yeah.
And this is what you should have done. Because then they constantly feel like they just want to talk. They just want to be.
Well,
like,
and you're not
right. They
raising
want
a
to tell you something.
A problem solver.
Yes.
If you're always solving.
Yes, exactly. They want you. Sometimes they just want you to listen.
Yeah.
But it sounds like a problem that you need to help them with. But sometimes they just want you to be there and listen.
I love that. And that's a good one for marriage.
So true. You're exactly right.
Do you want to vent? Do
Yes.
you want advice? Or do you want me to
Help you.
solve
Yes.
this?
Probably. Yes.
Yeah.
Probably with every relationship.
Yeah.
Yeah,
Yeah.
it's true. That's a good
That's
one.
good.
I like
You had really good ones.
Yeah.
Thanks.
Dr. Rachel Sullivan,
so-
thank you so much for coming
so
on
much
this
for having
show.
me.
It was so much fun.
Thank you. I
We'll
really
link
appreciate it.
everything.
Thank you.
Link everything in show notes.
Yeah. All right. Thanks, guys. Bye.